columnar epithelium. All other parts of GIT are lined by columnar epithelium. But oral cavity, esophagus, anal canal are lined by squamous epithelium. Oral cavity, esophagus and anal canal are lined by squamous epithelium. Therefore, if they ask you which is the most common cancer in GIT, then the answer should be adenocarcinoma. But in oral cavity, esophagus or anal canal, it would be squamous cell carcinoma. ये basic funda clear है? Then start with esophagus. So esophagus, as we know, it is a fibromuscular tube. How much in length? ये length पूछी गई थी. It is 25 centimeter. Esophagus is how much? Duodenum is how much? Duodenum is how much? Ureter is how much? 25 centimeters. So duodenum, ureter and esophagus are all 25 centimeters in length. कोई दिक्कत नहीं है. Spinal cord is how much? ये पूछा गया था. 45 centimeters. Spinal cord is 45 centimeter. याद रख लो ये लेंथ. ठीक है, important. So esophagus, it extends from which vertebral level? It starts from अरे pharynx जा खत्म होगा. Pharynx extends from the skull base till C6. So esophagus starts from it has two sphincters. One is the physiological plus anatomical sphincter, that is known as physiological plus anatomical is mainly anatomical बोलते हैं उसको. Upper esophageal sphincter. Okay, the upper one is the upper esophageal sphincter. Upper esophageal sphincter is at the level of pharyngoesophageal junction, and that is what is vertebral level C6. Whereas only physiological action is seen with lower esophageal sphincter. Only physiological action is seen with lower esophageal sphincter. Okay, so lower esophageal sphincter is how much in length? 3 to 5 centimeter. Lower esophageal sphincter is how much in length? 3 to 5 centimeter. What is the normal pressure of lower esophageal sphincter? 10 to 25 mm of Hg. What is the normal pressure of LES? 10 to 25 mm of Hg. ठीक है? So if this lower esophageal sphincter frequently relaxes, तो क्या होगा? There would be reflux of acid, and that will cause gastroesophageal reflux disease. Frequent relaxation causes good. Frequent relaxation causes, but constant spasm causes achalasia cardia. Constant spasm causes achalasia cardia. समझ गए? LES का फंडा. Important question था anatomy, physiology जो भी मान लो. Question था lower esophageal sphincter pressure is maintained by 4 things. Okay, exception में आया था, which is not a component of lower esophageal sphincter. So lower esophageal sphincter tone or pressure is maintained by 4 important things. First is angle of His. That is what is the gastroesophageal angle. So angle of His कौन सा होता है? Gastroesophageal angle. Second is the right crus of diaphragm. Third is the cardia. ठीक है? Stomach का जो ऊपर वाला part होता है, that is what is cardia. And the single most important factor is intra-abdominal esophagus. ये भी पूछा गया चुका है. Most important factor contributing to lower esophageal sphincter pressure, that is intra-abdominal esophagus. So the length of intra-abdominal esophagus is around 3 to 5 centimeter. The length of intra-abdominal esophagus is around 3 to 5 centimeter. ठीक है? So the most single important factor contributing to LES tone or LES pressure is intra-abdominal esophagus. ठीक है? No issue. If the intra-abdominal esophagus length is less, then the patient will have problems. ठीक है? Then the pressure would be less and GERD हो सकता है in patient. Constrictions are present in esophagus, as we know, right? So these constrictions are 4. Okay, there are 4 constrictions usually, and the distance is measured from the upper central incisors. So, at C6 level, okay, it is how much centimeters from the upper central incisors? It is 15 centimeters. It is how much? 15 centimeters. It is how much? 15 centimeters. T4 level is how much? T5 level is ज्यादा ही होगा ना कौन से. T5 level is 27 and T10 level is जल्दी से बताओ. Now these constrictions usually are due to what reason? ठीक है? At C6 it is due to the cricopharyngeal sphincter. At C6 it is due to the cricopharyngeal sphincter. At C6 it is due to the cricopharyngeal sphincter. That is what is your pharyngoesophageal junction. Next, T4 it is due to the arc of aorta. At T4 it is due to, at T4 it is due to, at T5 it is due to left main bronchus. At T5 it is due to, at T5 it is due to, sometimes they combine it. T4, T5 एक ही level पे बता देते हैं. And T10 it is due to, क्या हो गया? Hiatus. That is a diaphragmatic hiatus. Okay, diaphragmatic hiatus. ठीक है? या फिर right crust बोल दो, whatever you call it. ठीक है? तो जल्दी से cricopharyngeal sphincter how much centimeter? Arc of aorta how much centimeter? Then left mainstream bronchus. Diaphragmatic hiatus. These are four sphincters of, four constrictions of esophagus. Cricopharyngeal sphincter at which level? Arc of aorta, left main bronchus, diaphragmatic hiatus. इसी में बता दो जल्दी से. Now diaphragm, as we know, it has three important hiatus or openings for the structures to pass from thorax to the abdomen, and they are remembered by the mnemonic Voice of America, and they are remembered as T8, T10, T12. So at T8, what passes? So at T8 it is the vena cava hiatus. At T8 it is the, at T8 it is the, T8 it is the, at T10 what passes? Esophagus. T10 पे it is the esophageal hiatus. T10 पे, T12 पे aorta. T12 पे phrenic nerve passes from, diaphragm से ही पास होती है, कौन से लेवल पे पूछ रहा हूँ. Phrenic nerve passes from T8. Phrenic nerve passes from, phrenic nerve passes from, vagus nerve passes from, vagus nerve passes from, vagus nerve passes from, thoracic duct passes from T12. Thoracic duct passes from, the anatomy is an important question. ठीक है, याद रखो. Now if I talk about the first question that we have, if I talk about the congenital anomalies of the esophagus, a child was delivered and on suctioning the increased secretions. I hope all of you are quite aware, as there is fluid, amniotic fluid inside the baby's mouth, nose, into the lungs. Therefore, after delivery, we do suctioning. Question और एक पीडिया का बोल दो मुझे. Suctioning is done in which sequence? ये question था. Nose followed by mouth या mouth followed by nose? It is M followed by N. That is mouth followed by nose. So when we do secretion, this child is having increased secretion. Or sometimes they can even mention what? Drooling of saliva. They can mention drooling of. So drooling of saliva at birth usually would be present in the child. Okay. And the mother gives the antenatal history of polyhydramnios. That means excess amniotic fluid. Okay. So this polyhydramnios would be due to the continuous drooling of saliva from the mouth. What is the bedside test and confirmatory test? So what is the provisional diagnosis? Jaldi bata. So diagnosis is esophageal. Diagnosis is esophageal atresia. That means the esophagus is not formed properly. Along with that, esophageal atresia एक अकेला भी हो सकता है और it can be combined with other anomaly, and that is what is the tracheoesophageal fistula. Tracheoesophageal fistula. So which two congenital anomalies of esophagus are coexisting? First is esophageal atresia and second is tracheoesophageal fistula. We'll discuss about the types. ठीक है, जल्दी से बता दो. Now you are suspecting esophageal atresia. The child will present at birth with continuous drooling of saliva, or on suctioning there would be increased secretion. Antenatal history of polyhydramnios. You will suspect what? Esophageal atresia. Bedside test क्या करोगे? So you will try to pass a orogastric tube. Nasogastric बच्चों में नहीं जाती है usually. OG tube डालते हो तुम, ठीक है? So you will try to pass a orogastric tube in the child, ठीक है? And this orogastric tube, will it go into the stomach? No, it will not go into the stomach. Rather, there would be coiling of this orogastric tube. And this coiling of orogastric tube or inability to pass the orogastric tube is suggestive of esophageal atresia. I am saying suggestive still, okay? So for confirmation of coiling, you can do a X-ray. For confirmation of coiling, you can do a X-ray. What is the confirmatory test, anybody? Confirmatory test would be a confirmatory test would be a contrast study. Okay, thoracoscopy, esophagoscopy या tracheoscopy जो होती है, it is only done in type E, that is fourth type of fistula. ठीक है, बाकी सब में it is the contrast study. Barium iohexol is usually used. Which contrast is used? Which contrast is used? Iohexol. ठीक है, and then you can see the blind pouch of the esophagus or a tracheoesophageal fistula. If I talk about this, so here there are total how many types? 5 types of this anomaly. So first, or type A is when there is only esophageal atresia. There is only esophageal. So isolated esophageal atresia is type A. Isolated esophageal atresia is type. Isolated esophageal atresia is type. If there is esophageal atresia along with the proximal fistula, it is type esophageal atresia with proximal fistula. Esophageal atresia with proximal fistula. Then esophageal atresia with distal tracheoesophageal fistula. Then it is type esophageal atresia with distal fistula. Esophageal atresia with distal fistula. Type C. Then if there is esophageal atresia along with proximal as well as distal fistula. Esophageal atresia with proximal as well as distal fistula. It is type D. And if there is no esophageal atresia, only a isolated tracheoesophageal fistula, it is called as type E. And the fistula would be which shape? Fistula would be S shape. Fistula would be S shape. So jaldi se batana abhi. The most common type of esophageal atresia would be, the most common is type C. Okay, no issues with this. याद रखना. Most common is type C and least common is type B. याद रखना. So जल्दी से अब मैं random पूछ रहा हूँ, random answer करना. H type of fistula. H type fistula. Only esophageal atresia. Only esophageal atresia. Esophageal atresia with distal fistula. Esophageal atresia with distal fistula. Esophageal atresia with proximal fistula. Esophageal atresia with proximal fistula. Esophageal atresia with both fistula. No issues with this. Shabash. Most common is type C. ठीक है. Investigation of choice or confirmatory test would be contrast study. Okay. First line investigation or bedside test would be X-ray, on which you will see coiling of OG tube. Coiling of OG tube. ठीक है. No issues with this. The associated anomalies with esophageal atresia are remembered as, they are remembered as lateral. V for vertebral defects. A for anorectal defects. A for anorectal defects. C for cardiac defects. C for TE for tracheoesophageal fistula. TE for tracheoesophageal fistula. R for renal anomalies. L for limb defects. Most common would be cardiac defects. Most common are, so jaldi se bacterial important है. ठीक है. V for, A for, C for, D for, R for, L for. Next, if I talk about the treatment now, ठीक है. If a patient has type A fistula, type A esophageal atresia, that means only esophageal atresia. Okay. If the two ends of the esophagus, if these two ends are close to each other, then what can be done? We can join the two ends, and joining it is called as re-anastomosis. Joining is called as re-anastomosis. ठीक है. या फिर अगर हम किसी structures को जोड़ते हैं, then that is called as ostomy. जिनको doubt है अभी भी surgery के इसमें terminologies में important. Ostomy is joining. Ectomy is removal. Otomy is opening. कोई दिक्कत नहीं है. Next, if I talk about if the two ends are closer, I will perform a esophageal re-anastomosis. Esophageal re-anastomosis. Yeah, I can also write it as esophagostomy. Esophago. That is nothing but re-anastomosis. No issues with this. But if the two ends are far, agar dur hai, then we need to wait for the child to grow. That means the ends will also grow towards each other, right? So first, for nutrition, we need to give what? IV fluids इतने टाइम तक तो नहीं दे सकते तुम. For 2 to 3 months you need to wait usually. So you will perform a gastrostomy. You will perform a so for nutrition initially you perform a gastrostomy, and after when the ends grow towards each other, then you perform a re-anastomosis or esophagostomy. No issues with this. So if the two ends are far, what is the initial treatment? When the ends grow towards each other, then now in types B, C, D or E. Okay, it depends on the birth weight of the child. इतना usually deep में जाके नहीं पूछेंगे. If it is less than 1.5, 1.5, 2.5. Just remember, if it is type B, C, D or E, we have a surgery known as, which surgery, anybody? It is known as the Cameroon Head surgery. It is known as which surgery? Cameroon Head surgery. Which surgery for type B, C, D and E? Which surgery is for type B, C, D and E? Which surgery is for type B, C, D and E? Cameroon Head surgery is nothing. You cut the fistula, you repair the trachea with sutures, and you join the esophagus. That is what is the Cameroon Head surgery. Okay, no issues with this. So cut fistula, repair trachea, join the esophagus. That is what is there. Okay. So usually a Cameroon Head naam to mostly nahi puchenge. They will definitely ask you for type A mainly. If a patient presents, okay, now if a patient presents with heartburn, epigastric and retrosternal pain, the patient didn't respond to lifestyle modifications, what is the next step to be done? So सबसे पहले तो ये बताओ, what is your diagnosis in this condition? The diagnosis over here is GERD. GERD is gastroesophageal reflux disease. Gastroesophageal reflux disease. Okay, what is the classical triad of GERD? Heartburn, epigastric pain, retrosternal pain. What is the classical triad of GERD? Heartburn, epigastric pain, retrosternal pain. Okay, it is due to reflux of acid into the esophagus. And why does this occur? What is the most common cause? As I told you, the most common cause is increased frequency of lower esophageal sphincter relaxation. Increased frequency of sometimes they say increased frequency of transient lower esophageal sphincter relaxation. That means for a shorter duration of time it relaxes, again it contracts. Okay? Normally the lower esophageal sphincter is in a state, contracted state. Whenever food comes, only then it dilates. But in GID what happens? The lower esophageal sphincter will keep on dilating. Beach mein it will keep on dilating, and that causes the reflux. Okay? So what is the most common cause of GERD? Increased frequency of transient lower esophageal sphincter relaxation. What is the most common cause of GERD? Increased frequency of transient LES relaxation. No issues with this? Yaad rakho. Then, if I talk about the classical triad we have spoken about, GERD, definitely the first line management would be lifestyle modification. That means avoid fatty, fried foods, avoid spicy foods, do exercise, don't eat food before 2 hours like from bed, okay? So avoid food like at least 2 hours before bed, you should have your last meal. All of these pandas, okay? But if the patient is not responding to medical lifestyle modification, the next line would be drugs, and the drug of choice are proton pump inhibitors. Drugs like prazole, omeprazole, pantoprazole, okay, lansoprazole, all of that. Okay? Apart from prazoles, we can also give drugs which will increase the peristalsis. Those are known as prokinetic agents, and prokinetic agents are drugs like mosapride, etopride. Okay, prokinetic agents are like drugs like etopride or mosapride. Okay, yaad rakho. No issues with this. Yaad rakho. If the patient does not even respond to PPI therapy now, then the treatment would be, but pehle diagnosis bata do. Investigation of choice is done by, so investigation of choices. So याद रखना, investigation of choice in GERD. अगर तुम endoscopy बहुत सारे books बोलते हैं, but I'm not sure. First line is definitely endoscopy. You can perform endoscopy, but on endoscopy you can pick GERD only when there is a metaplastic change which is seen. That means at the stage of Barrett's you can pick up GERD. ठीक है? उसके पहले तो कैसे pick up करोगे? Endoscopy में you can watch this, okay, lower esophageal sphincter relaxation, but that would not be diagnostic again. ठीक है? So मेरे हिसाब से usually the investigation of choice or gold standard. Most of the books write it as ambulatory 24-hour pH monitoring. It is ambulatory 24-hour pH monitoring. So what is the gold standard or investigation of choice? Ambulatory 24-hour pH monitoring. So you assess the pH in the esophagus. Normal pH of esophagus is 5 to 7. But if the pH of esophagus falls to less than 4, if the pH of esophagus falls to less than 4 for more than 4 times in a day, for more than 4 times in a day, okay, then it is called as GERD. Okay, then it is diagnosed as GERD. कितनी बार होना चाहिए pH? 4 times. कितने से कम? 4 से कम. ठीक है? So what should be the pH less than? For how many times a day? Then it can be diagnosed as investigation of choice or gold standard for GERD is ambulatory 24-hour pH monitoring in the esophagus. No issues with this? I hope so. ठीक है? And here you also have a score known as Johnson-Demeester scoring. Which score is used? Johnson-Demeester scoring. Which score is used? Johnson-Demeester score is also used. ठीक है? No issues with this, anybody? So if they ask you, Demeester score is used for diagnosis of, it is used for diagnosis of GERD. If they ask you, now patient was not responding to lifestyle modification, so we started PPI. Patient is not responding to medical therapy. Treatment is surgical therapy. And what is that surgery of choice? Surgery of choice is fundoplication. Surgery of choice is fundoplication. Fundoplication means pull up the fundus of the stomach and wrap it around the esophagus. Okay, it can be anterior 180-degree fundoplication known as DORS. Anterior 180 degree is known as DORS. Anterior 180 degree is known as DORS. Posterior is known as Taupet. Posterior is known as no issues with this. कोई दिक्कत? And if it is a 360-degree fundoplication, then it is called as Nissen. If it is a 360-degree fundoplication, it is called as. So what is the surgery of choice in GERD? What is the surgery of choice in GERD? What is the surgery of choice in GERD? Nissen fundoplication. No issues with this, anybody? याद रख लो, image भी आ चुकी है. Then if I talk about esophageal cancer now. So esophageal cancer can be either a squamous cell carcinoma or a adenocarcinoma. So why adenocarcinoma develops? Please tell me what is the most common complication of GERD? The most common complication of GERD is? Don't answer it as Barrett's. Okay? Most common complication, if they ask you, answer is esophagitis. If GERD is for a longer duration of time, now the lower esophagus will show metaplastic changes. Which type of metaplasia is seen? So it will change from squamous to columnar. So it is an intestinal metaplasia. Which type of metaplasia? Intestinal metaplasia. And the hallmark feature of Barrett's is goblet cells. Hallmark feature of Barrett's is goblet cells. No issues with this, anybody? So most common complication is esophagitis, which can further progress to Barrett's esophagus, and which will be at a higher risk of causing which esophageal cancer? Squamous cell or adeno? Barrett's esophagus is a risk factor for adenocarcinoma. नाम में ये adeno arises from columnar epithelium. ठीक है? So it can be either a squamous cell carcinoma or a adenocarcinoma. Sorry. Most common in India is? Most common esophageal cancer in India is squamous or adeno? In India it is? Worldwide it is? Overall it is? Squamous. Overall it is? Western countries it is? Fatty food, fast food कौन खाता है? Western countries. So in Western countries the most common esophageal cancer is, but in India or overall the most common esophageal cancer is squamous cell carcinoma. Most common site for squamous cell carcinoma is? Middle 1/3. Most common site for squamous cell carcinoma is? Most common site for adenocarcinoma is? Most common site for adenocarcinoma is? So the reflux will occur in the lower esophagus, right? Therefore, Barrett's will occur in the lower part of the esophagus, at the lower esophageal sphincter, and that is the place where we can see adenocarcinoma. So most common site for squamous cell carcinoma, middle 1/3. Most common site for adenocarcinoma, shabash. Risk factors for squamous cell carcinoma. So common risk factors for both of them can be smoking, alcohol intake, fast food, fatty food, fried food, spicy food, all of that. ठीक है? Important risk factor for squamous cell carcinoma can be a condition known as atresia cardia. It is a condition known as atresia. So important for squamous cell carcinoma is atresia. So atresia cardia causes which carcinoma? Atresia cardia causes which carcinoma? Please remember, atresia cardia is not the most common risk factor. Okay? It is not the most common, but it is a special type. इसीलिए लिखवा रहा. I'm not telling all of you all of these things. Okay? So atresia cardia causes which type of cancer? Squamous cell carcinoma. Whereas Barrett's esophagus causes which type of cancer? Barrett's esophagus causes which type of cancer? That intake of foods with preservatives, smoked food, these can also be the risk factors for both of these cancers. Okay? Tylosis, palmar or Prander tylosis is usually a risk factor for squamous cell carcinoma. It is a risk factor for squamous cell carcinoma. No issues with this? Yeah, esophageal cancer is common in which age group? It is more common in 5th to 6th decade. It is more common in 5th to 6th decade, sometimes 4th decade as well. Then if I talk about esophageal cancer, the first line, the most common symptoms would be what? Most common symptoms would be, first of all, the most common and the earliest symptom would be dysphagia. Most common and earliest symptom would be, dysphagia would be progressive or non-progressive? Dysphagia would be, because the size of the tumor will increase continuously, right? Therefore, there is a progressive dysphagia. Please tell me, it is important to differentiate. Dysphagia would be more to liquids or solids? More to liquid or solids? More to solids as compared to liquid. More to solids as compared to liquid, because there is an obstruction. In atresia, it is reverse. In atresia cardia, the dysphagia is more common to liquids as compared to solids. No issues with this. इसके अलावा बाकी pressure symptoms आ सकते हैं, Stridor वगैरह, all of that can also occur. No, halitosis would be that bad breath, sour branch or reflux of acid into mouth, sour branch, dental caries, all of that can occur. That will also occur in GERD. Then if first line investigation would be what? First line investigation would be a barium. First line investigation is a barium. And on barium value, what can be seen? Barium value, what can be seen? Yeah? कौन सा appearance? Come again. Here you can see there is a shaggy appearance. ठीक है? Shaggy borders are there. Bird beak shaggy होती है क्या? नहीं होती. So this is not a bird beak appearance at all. Don't dare to call it esophageal cancer as bird beak appearance. It is not sharp margin, so it cannot be bird beak appearance. It is a rat tail appearance. It is which appearance? It is which appearance? So rat tail appearance on barium swallow is the feature of rat tail. Rat tail appearance on barium swallow is the feature of esophageal cancer. Rat tail appearance on barium swallow is the feature of rat tail appearance on barium swallow is the feature of rat tail appearance on barium swallow is the feature of. How to confirm it further? Along with that, you can also see some filling defects. Along with that, you can also see some filling. ठीक है? So अगर तुम्हें ये नहीं दिख रहा, क्या बोलते हैं, bird beak और rat tail में difference नहीं कर सकते, so please remember you also need to find for filling defect. And in atresia, the proximal esophagus is massively dilated. Here it is not massively dilated. Please remember this funda. No issues with this, anybody? I hope so. What is the treatment? Investigation of choice बताओ जल्दी. Investigation of choice है बस endoscopy से पता चलता है कि कैंसर है. So it is upper GI endoscopy plus upper GI endoscopy plus upper GI endoscopy plus. And what is the treatment? So treatment is this one, surgery. Treatment is definitely surgery. It is cancer, so treatment is definitely surgery. If upper 1/3 is involved, it is with surgery. Esophagectomy करेंगे. The surgery would be nothing but esophagectomy. What is the margin taken in esophagectomy? Anybody? The margin taken in esophagectomy. Very good. It is proximally, distally. So margin for esophagectomy proximally, distally 5 centimeter. Okay. So surgery for upper 1/3 of esophagus. So upper 1/3 अगर involved है, you will perform a total or partial. So you can perform a total or partial. जल्दी बताओ. Upper 1/3 है तो total esophagectomy. Upper 1/3 है तो total esophagectomy would be performed, and that is what is known as the Meckel surgery. With surgery, अपर थर्ड के लिए, अपर थर्ड के लिए, अपर थर्ड के लिए, मिड थर्ड के लिए, आई विल रिवाइज, मिड थर्ड के लिए, मिड थर्ड के लिए, मिड थर्ड के लिए, लोअर थर्ड के लिए, oringal, lower third के लिए, lower third के लिए. If it is lower 1/3 esophagus, then you can perform a partial esophagectomy and you can pull up the stomach. Okay, you can pull up the stomach. Upper है, यहाँ तक तो stomach को pull usually नहीं करते. ठीक है, तो याद, upper 1/3 with surgery, upper 1/3 with surgery, upper 1/3 with surgery, middle third with surgery, middle 1/3 with surgery, I will revise, lower 1/3 with surgery, lower 1/3 oringal. No issues with this. All are types of esophagectomy. Proximal margin 10 cm, distal margin to 5 cm. Now investigation of choice, as we already saw, it is upper GI endoscopy plus, upper GI endoscopy plus distant metastasis के लिए investigation of choices PET scan. Distant metastasis के लिए, distant mets के लिए, distant mets के लिए, and the most common site of distant metastasis is, most common site of distant metastasis is, most common site of distant metastasis in esophageal cancer is depth or so how much the cancer is invading into the tissue, that is depth or TNM staging के लिए, depth of invasion or TNM staging. एंडोस्कोपिक क्या, एंडोस्कोपिक अल्ट्रासाउंड. डेप्थ ऑफ इन्वेजन के लिए, डेप्थ ऑफ इन्वेजन के लिए, डेप्थ ऑफ इन्वेजन के लिए, टी एंड एंड स्टेजिंग के लिए एंडोस्कोपिक अल्ट्रासाउंड. टी एंड एंड स्टेजिंग के लिए एंडोस्कोपिक. टी स्टेजिंग इज व्हाट, डेप्थ ऑफ द इन्वेजन. एंड स्टेजिंग इज व्हाट, नोड इन्वॉल्वमेंट. दैट इज व्हाट. ओके, so it is endoscopic ultrasound. For overall staging it is, overall staging it is PET CT. Overall staging it is, overall staging it is PET CT. No issues with this anybody? CCT prefer करा जाता था पहले. Nowadays we also look for other distant metastasis in the single investigation. So if you have PET CT in option, mark PET CT. If you don't have PET CT in option, then mark it as CECT. कोई issue नहीं है? I hope so. And पेट एमआरआई यूजुअली जब तुम्हें वॉल देखनी होती है, बट इसमें जीआईटी में नहीं यूज होता वो. जो पेट एमआरआई फॉर न्यूरल टिश्यूज और फॉर योर अनोरेक्टल मालफॉर्मेशंस वगैरह, ओवर देयर इट पेट एमआरआई कैन बी. पेट सीटी इज प्रेफर्ड. पेट एमआरआई इज वेरी एक्सपेंसिव, वेरी वेरी एक्सपेंसिव. ठीक है, याद रखना. व्हाट इज द डाई यूज्ड इन पेट? द डाई यूज्ड इन पेट और 18 FDG. डाई यूज्ड इन पेट इज 18 FDG, 18 फ्लोरोडिऑक्सी ग्लूकोज. क्वेश्चन था, डाई यूज्ड इन पेट स्कैन इज 18 FDG. Dye used in PET is 18 FDG, fluorodeoxy glucose. Fluorodeoxy glucose. Half life of 18 FDG is 110 minutes. Half life of FDG is 110 minutes. No issues with this. Important है यार, ये PET scan वाला तो रटा हुआ होना चाहिए. 18 FDG क्वेश्चन आ चुका है बहुत बार. 18 FDG. A 56-year-old male presents with regurgitation of food, halitosis and intermittent dysphagia. What is your provisional diagnosis? Investigation of the provisional diagnosis is, provisional diagnosis is, so what is the triad of Zenker's diverticulum? First is regurgitation of food. Earliest is, earliest is, earliest is, next is halitosis of bad breath, next is halitosis, and third is dysphagia. Would you progressive or non-progressive? Non-progressive intermittent dysphagia. Non-progressive intermittent dysphagia. What is the investigation of choice, anybody? Investigation of choices. So all other places usually contrast study is the first line investigation, but in Zenker's barium swallow contrast study is the investigation of choice. ठीक है? So investigation of choice for Zenker से, investigation of choice for Zenker से. On barium swallow, what would we see? What do we mean by a diverticulum? Diverticulum means a outpouching. Diverticulum means a outpouching from the organ. So here you can see this outpouching from the esophagus. Which side, anterior or posterior? So posterior diverticulum is seen. Please let me know Zenker's diverticulum. Will it contain all the layers or only the mucosa? It will only contain the mucosa. Therefore, it is a true diverticulum or a false diverticulum. Therefore, it is a false diverticulum. Zenker's is which type of diverticulum? Zenker's is which type of diverticulum? It is more common in which age group? Children, elderly, or adult? It is more common in. It is more common in. It is more common in because the esophageal wall becomes weak, right? So, it is pulsion type of diverticular or a traction type of diverticular? So, due to increased pressure, it is a pulsion diverticular. Due to increased pressure, it is a. So, Zenker is which type of diverticular? Pulsion or traction? Pulsion or traction? False or true? False or true? More common in which age group? Most common site is. Most common site is. Most common site is Killian's dehiscence. So this Killian's dehiscence is actually a weak triangle in which muscle? One answer karna ho to inferior constrictor muscle. It is a weak triangle in the inferior constrictor muscle. It is a weak triangle in the inferior constrictor muscle. And inferior constrictor is made up of two fibers: oblique thyropharyngeus, and circular cricopharyngeus. Circular cricopharyngeus. And this weak triangle is known as. So most common site for Zenker cell. Most common site for Zenker cell between which two fibers? Thyropharyngeus and cricopharyngeus, and in which muscle? Which muscle? No issues with this. तो दोनों क्वेश्चन आ सकता है. मसल अगर पूछा तो डोंट गेट कंफ्यूज क्योंकि टीपी और सीपी रट चुके प्रीवियस ईयर क्वेश्चन की वजह से. ठीक है, तो इंफीरियर कंस्ट्रिक्टर के ही फाइबर्स होते हैं. नेक्स्ट, इफ आई टॉक अबाउट सर्जरी, इफ द Zenker's diverticulum is less than 2 cm, what should be done? We will remove the diverticulum. That is, so if it is less than 2, you will perform. If it is less than 2, you will perform diverticulectomy. If it is less than 2 cm, you will perform less than 2. Less than 2. If it is more than 2 to 4, Dollmann's operation. If it is more than 2 to 4, if it is more than 2 to 4, if it is more than 2 to 4, Dollmann's operation. Dollmann's operation is nothing but diverticulopexy. Pexy means what? Or एक important part. Pexy means fixation. Pexy means fixation of any organ. ठीक है? So here Dollmann's operation is nothing but diverticulo. It is nothing but diverticulo. ठीक है? It is done with circular stapler nowadays. ठीक है? No issues with this. याद रखना. Less than 2 cm. Less than 2 cm. More than 2 to 4. More than 2 to 4. No issues with this. Anybody? इसमें इक्वल होगा. सॉलिड लिक्विड फ्यूजन इक्वल होता है. दोनों के लिए होता है. सॉलिड एंड लिक्विड दोनों के लिए देयर वुड बी dysphagia. ठीक है, अगर होता है तो. बट इट वुड बी इंटरमिटेंट इन नेचर. कभी होगा कभी नहीं होगा. ठीक है. Zenker, ठीक है. नो इश्यूज विद Zenker. वेरी गुड. नेक्स्ट, इफ आई टॉक अबाउट दिस वन, अ चाइल्ड डिलीवर्ड प्रीटर्म. प्रीटर्म मींस लेस देन 34 वीक्स ऑफ. Preterm means less than 37 weeks of gestation. Okay, and had respiratory distress and an increased anteroposterior diameter of chest. If there is increased anteroposterior diameter of chest, it is called as barrel chest. Increased anteroposterior diameter is called as barrel chest. So if a child is delivered preterm or premature, respiratory distress along with a barrel chest and something like this, a scooped out abdomen is seen. Okay, scooped out abdomen is seen. What is this known as? Scooped out abdomen is known as a scaphoid abdomen. Scooped out abdomen is known as the. And why this scooped out abdomen occurs? Because the abdominal content, that is your bowel, from a abnormal diaphragmatic opening will enter into the thoracic cavity. It will enter into the thoracic cavity. So if you perform the first line investigation, what is the first line investigation? First line investigation is a chest X-ray. On chest X-ray, what can be seen? You can see bowel loops in the thorax. What can be seen in chest X-ray? What can be seen in chest X-ray? What can be seen in chest X-ray? What would be the abdomen shape? What would be the abdomen shape? And what would be the chest? Chest would be increased anteroposterior diameter. So these are the classical 3 important findings for which condition? So the diagnosis is congenital diaphragmatic hernia. The diagnosis is congenital diaphragmatic hernia. The diagnosis is congenital diaphragmatic hernia. Okay, important. So it is due to abnormal opening in the diaphragm. through which the abdominal contents go into the thoracic cavity, and therefore the patient will have respiratory distress because they will compress the lungs. Congenital diaphragmatic hernia, most common type is Morgagni वाले हाथ उठाओ, क्लास के बाद मिलेंगे. Most common type is gauche direct hernia. Most common type is is it anteromedial or posterolateral? It is a posterolateral. Hernia. Left side or right side? More commonly on the left side. So left-sided posterolateral hernia is called as gauche direct. Left-sided posterolateral hernia is called as anteromedial hernia is called as Morgagni. So less common is Morgagni. Media से भी important question है. Diaphragmatic hernia alternate exams में पूछा जाने वाला question है. ठीक है. Most common type is gauche direct. It is on which side? Which wall? Posterolateral. Anteromedial is Morgagni. So if a patient is having respiratory distress, you will give ventilation to the child, but which ventilation is contraindicated? Very good. Which ventilation is contraindicated? Bag and mask. Which ventilation is contraindicated? Bag and mask. Which ventilation is contraindicated? ये question आ चुका है. Bag and mask ventilation is contraindicated. ठीक है. No issues with this. Therefore, you will insert a ET tube वगैरह. No issues with this. Anybody? क्या? Mechanical ventilation can be of different types. Mechanical can be anything. Mechanical is means with the help of a machine. That is what is a mechanical ventilation. ठीक है. कुछ भी हो सकता है वो. Bag and mask is usually a manual ventilation जो तुम ambu bag के साथ देते हो. ठीक है. So वो नहीं, वो contraindicated होता है because it covers the mouth also. ठीक है. Now important, please tell me what is the most common cause of death in this condition? Respiratory distress or pulmonary hypoplasia. Most common cause of death is pulmonary hypoplasia. That means the lung is not able to develop. Most common cause of death is no issues with this. Investigation can be done by clinical examination, X-ray, and then by a contrast study also. या CECT abdomen कर सकते हो. Okay, investigation of choice is usually a CECT abdomen. No issues with this. So the contrast will be seen in thorax. ठीक है? And treatment would be repair. Okay, treatment would be the diaphragmatic repair. No issues with this. Then if I talk about other hiatal hernia, if there is a abnormal opening in the diaphragmatic hiatus, if it is a wide opening, so now what can happen? The esophageal, so the esophagus can just go and come back in from the abdomen to the thorax. So this is called as which type of hernia? If the gastroesophageal junction goes and comes back into thorax and abdomen, it is called as sliding hiatal hernia. And if the stomach goes into the thoracic cavity, it is called as paraesophageal. If stomach goes into the thoracic cavity, it is called as also known as rolling hiatus hernia. More dangerous is rolling hiatus hernia because there would be a high risk of necrosis. Of the protruding abdomen. Okay, or protruding abdominal contents. Okay, important. So most common hiatal hernia is most dangerous hiatal hernia is paraesophageal is also called as. Stomach goes in which type? Rolling. Gastroesophageal junction goes in which type? So gastroesophageal junction important है यार. It remains in the abdominal cavity in paraesophageal. It remains in the abdominal cavity in, but it goes in the thorax in. So if the gastroesophageal junction is in the thorax, it is which type? If gastroesophageal junction is in the thorax, it is which type? If it is in the abdomen, it is which type? Paraesophageal. No issues with this, anybody? Treatment is again diaphragmatic repair. Reduction of the abdominal content and diaphragmatic repair should be done. But again, if we do a diaphragmatic repair, there is a high chance of GERD. So along with that, sometimes we might require a fundoplication. So the treatment of choice is usually treatment of choices. Which fundoplication? No issues with this, anybody? Treatment of choice for hiatal hernia. Descends fundoplication. ठीक है? Moving further. Investigation of choice would be a CECT again. So the best investigation for this would be a CECT abdomen. Best investigation would be a CECT. So diaphragmatic hernia or hiatal hernia. Investigation of choices. No issues with this. ठीक है? Barium swallow would be a initial investigation, first line. But investigation of choice would be a CECT. Investigation of choice would be a CE. कोई दिक्कत नहीं है, anybody? क्या हुआ? हाँ, if there is a paraesophageal hernia, there would be decreased blood supply to the cardia of the stomach, and there would be a high risk of Cameroon's ulcer. So these are seen in the stomach. Stomach में और दो type के ulcer दिखते हैं. Curling ulcers are seen in burns. Curling ulcers are seen in Cushing's ulcers are seen in head injury. Cushing's ulcers are seen in both of these types are stress ulcer. In head injury we can see Cushing's ulcer. Burns में Curling ulcer. And in paraesophageal hiatal hernia, Cameroon's ulcer. Moving further, a child presented to the ER with ingestion of button battery. Important question है. ENT surgery दोनों से बार-बार ये foreign body का question आता है. A child presented to ER with ingestion of button battery. Chest X-ray shows impaction distal to the cricopharyngeal sphincter. So please tell me what is the most common site of impaction of foreign body? Most common site of impaction of foreign body is cricopharyngeal sphincter. Why? Because it is the narrowest portion of GIT. Do one-liners. Narrowest portion of GIT. And therefore the most common site of foreign body impaction is cricopharyngeal sphincter. Okay? But here the child has ingested a button battery and it is distal to the cricopharyngeal sphincter. Okay? What is the treatment of choice? Will you wait and observe the child or will you remove it immediately? So it is a immediate endoscopic removal. What should be done? Immediate endoscopic removal. Why? It is a button battery. Okay, and button battery will release alkali. Button battery will release alkali, and that can cause necrosis of the esophagus. Therefore, if a child has ingested battery, wherever it is whether it is at the cricopharyngeal sphincter or distal to it, treatment of choice would always be immediate endoscopic removal. Treatment of choice is always immediate endoscopic removal. If it is some other foreign body, the most common foreign body in children is most common foreign body in adults is food material, that is fish bone वगैरह. Most common foreign body in adults is कौन सा manure? Hemorrhagic manure. शाबाश. And most common foreign body in elderly is usually dentures. दांत गिर गए ना अंदर चले जाते हैं. ठीक है? So if depending on the foreign body impaction site, we will treat the patient. If it is not a deadly foreign body like a button battery, then we will check the level of the foreign body by an X-ray. Okay, if the foreign body level is at the C6, then the treatment of choice would be. If the foreign body is at C6, treatment of choice is. If the foreign body is at C6, then treatment of choice is. But if the foreign body is distal to C6, that means it is a short foreign body and it has crossed the cricopharyngeal sphincter. If the patient is asymptomatic, then observation and serial X-rays would be taken. Okay, serial X-rays would be taken. Okay, and next morning क्या देखोगे तो? Next morning प्रस्थान किया या नहीं ये देख लोगे. ठीक है? So if the foreign body has passed by the stools or not. ठीक है? So observation should be done with serial X-rays. And if it is a child, you will promote giving meshy foods like banana, jellies. All of this will be given to encourage the smooth passage of this foreign body. Okay, no issues with this. But if the patient is symptomatic, then again, the patient is symptomatic, then symptoms can be stridor, distress, aphonia, all of that. Okay? So if it is a normal foreign body, at the level of C6, treatment of choices, at the level of C6, treatment of choices, distal to C6, asymptomatic patient, distal to C6, asymptomatic patient, distal to C6, symptomatic patient, endoscopic removal again. ये question आ चुका था. So if the foreign body is in the trachea, that means a coin, if it is in the trachea, on anteroposterior or PA view, sorry, AP view नहीं, AP भी ले सकते हो, PA view है. So on a PA view on X-ray and a lateral view on X-ray, क्या changes दिखेंगे? If the foreign body appears, if the foreign body appears slit like in PA view and circular in lateral view, it is in trachea. Slit like in PA view, circular in lateral view. The foreign body is in, jaldi se, slit like in, circular in, circular in, then the foreign body is in. If the foreign body appears circular in PA view, circular in and slit like in, then it is in the, and और एक important बात है, if the foreign body is in the esophagus, in front of the foreign body you will be able to appreciate, you will be able to appreciate a air column. You will be able to appreciate a air column. That is what is suggestive of a trachea. But in trachea, if it is there impacted, then here you would not be able to appreciate any air column as such. ठीक है, याद रखना. So जल्दी से, ये important है इसलिए जल्दी से करेंगे. If the foreign body is in trachea, on PA view it will appear, on PA view it will appear, on lateral view it will appear, lateral view it will appear. If the foreign body is in esophagus, PA view it will appear, on PA view it will appear, lateral view it will appear, lateral view it will appear. For air column, it is seen in esophageal foreign body. Air column is seen in, ये तो पता ना, ट्रेकिया आगे होता है esophagus, esophagus पीछे होता है, important, ठीक है. And esophagus का usually जो anteroposterior diameter होता है, that is smaller. Okay, the horizontal diameter is wider. Therefore, the foreign body usually goes like this. ठीक है. But in trachea, the anteroposterior diameter is wider, and therefore the foreign body will go like this. ठीक है. No issues with this, anybody? Moving further, a 30-year-old Kamlesh, ठीक है, 30-year-old male Kamlesh chronic alcoholic, पता है ना? नहीं है. A 30-year-old male Kamlesh chronic alcoholic presents to emergency room with chest pain and retching episode. He gives history of binge drinking episode. On palpation, crepitus is felt. What is the diagnosis? Mallory Weiss is a partial tear or a complete tear? Mallory Weiss, याद रखना, Mallory Weiss tears are usually a partial submucosal tear. Mallory Weiss tears are partial submucosal tear. They will only present with bleeding. They will only present with bleeding and chest pain. They will only present with bleeding and chest pain. याद रखना. So Mallory Weiss tears are partial or submucosal tears in the esophagus. Yes, definitely they are also seen in alcoholic patients with a history of binge drinking and coming to you with retching episode. Here there is a complete rupture of the esophagus. I have explained it in GIT. Complete rupture of esophagus in a chronic alcoholic patient having an episode of binge drinking. Now there is excessive vomiting or retching episode. Okay, retching is vomiting की कोशिश करना, ठीक है. So retching or vomiting episode, chest pain, and this crepitus on palpation is suggestive of anybody. Subcutaneous emphysema. This crepitus is suggestive of subcutaneous. That means air is present, okay, beneath the skin. So this classical triad concept: diffuse chest pain, retching episode, and subcutaneous emphysema. Chest pain, retching episode, and subcutaneous emphysema is the triad known as. This is known as the. And macular striatum is seen in which diagnosis? Macular striatum is seen when the esophagus undergoes transmural or complete rupture, and that is what is your. Boerhaave syndrome. ठीक है. In Boerhaave syndrome, which striatum is seen? Boerhaave syndrome, which striatum is seen? Macular striatum is seen in. Macular striatum के तीन feature. First is First is second is third is subcutaneous emphysema. So Meckel has tried to get three pictures. First is, second is, third is subcutaneous emphysema. No issues with this. First line investigation is a chest X-ray. On chest X-ray, as the air will escape out from the esophagus into the mediastinum, there would be pneumomediastinum, and chest X-ray feature of pneumomediastinum. Medicine हो चुका है भाई. It is pneumoperitoneum की पूछा मैंने, pneumomediastinum की पूछा. That is also same. Cupula sign is what is gas under diaphragm. Continuous, it is pulmonary embolism. Continuous diaphragm sign. It is the continuous diaphragm sign. GIT का नहीं देखा, it is uploaded on the app. Please watch it. 30 minute का video है बस short. You can watch it. ठीक है? So GIT important है. ठीक है? So जल्दी से, what is the chest X-ray feature of pneumomediastinum? Continuous diaphragm sign. What is the chest X-ray feature of pneumomediastinum? Continuous diaphragm sign. Air column is seen beneath the heart. ठीक है? That is what is the continuous diaphragm sign. No issues with this. And on auscultation, a very characteristic sign is heard in pneumomediastinum. Auscultation by which sign is heard? Very good. That is a crunching sound is heard. Due to this emphysema, a crunching sound is heard. That is what is known as. अरे ऐसे easy चीजें क्यों पूछ रहे हो? Hammond crunch sign. On auscultation, a crunching sound is heard on the chest, and that is what is called as the Hammond crunch sign. When it feels like a person is walking with leather boot on the snow. ठीक है? Crunching sound is heard. Pneumomediastinum की chest X-ray feature, continuous diaphragm sign. Pneumomediastinum का chest X-ray feature, continuous diaphragm sign. Auscultation feature, Hammond crunch sign. Auscultation feature, Hammond crunch sign. Investigation of choice, contrast enhanced CT scan. Investigation of choice, contrast enhanced CT scan. But which type of contrast is used? Water soluble contrast. No issues with this. And what is the treatment of choice? ये medicine का question है. But treatment surgery क्या आती है इसमें? Treatment is thoracotomy with mediastinal lavage. Thoracotomy with mediastinal, because there would be a higher risk of mediastinitis in the patient, and that is the most common cause of death in this patient. 50% patient मरता है इसमें. ठीक है? Therefore, it is important to diagnose this condition. ठीक है? So most important treatment would be thoracotomy. Open the thorax and perform a mediastinal lavage. Clean the mediastinum. And then repair the esophagus. No issues with this, anybody? Then if I talk about next one, atresia cardia. What is the most common cause of atresia cardia? Loss of tone or increased tone? So usually it is due to the increased tone of the lower esophageal sphincter. Increased tone of the lower esophageal sphincter. The lower esophageal sphincter is in constant spasm. It is in the constant spasm. Normal pressure of LES was 10 to 25 mm of Hg. In atresia, it would be more than. In atresia, the pressure is more than. 25 mm of Hg. No issues with this. So the most common cause is increased tone of the lower esophageal sphincter. Other cause can be loss of inhibitory ganglia. Loss of inhibitory ganglia. And तीसरी और एक cause है usually the relaxing substances like vasoactive intestinal peptide or nitric oxide are deficient in this patient. ठीक है? So what is the most common cause? Increased tone of the lower esophageal sphincter. The other cause can be loss of inhibitory ganglia. So these inhibitory neurons would be absent in the orbus or the myenteric plexus. ये question था. In atresia cardia, the inhibitory ganglia or the inhibitory neurons are absent in which plexus? Orbus or mesenus? The answer is orbus or the myenteric plexus. Okay, no issues with this, anybody? What would be the symptom? First and the earliest symptom is? Earliest of the first symptom is dysphagia. Earliest of first symptom is progressive or non-progressive? So here the patient will have progressive dysphagia. Okay, the patient will have dysphagia. No issues with this. Zenker's में there was non-progressive. Here it is progressive dysphagia. dysphagia would be more to, because liquids are lighter, so they can pass. Okay, important. So this, sorry, the liquids are lighter, therefore they could not pass. Solids are heavier, therefore they can pass. So dysphagia is more to liquid. Then the other features can be regurgitation. The other feature can be, so if they ask you which is the earliest feature, it is earliest feature is in Zenker or atresia. The earliest feature is in Zenker or atresia. The earliest feature is regurgitation. Dysphagia usually is a late feature. Okay? Dysphagia is a progressive dysphagia more to liquids as compared to solids. And again, halitosis would also be seen in this condition. Okay? What is the investigation of choice? Anybody? So, if the patient comes to you with this classical feature, most common age group affected is usually 20 to 40 years of age group. That is, young patients are affected. Mostly young patients are affected. Whereas Zenker, elderly patients are affected. याद रखना ये बहुत क्लोज केस आता है. 3 सिम्टम्स उसमें भी है, 3 सिम्टम्स इसमें भी है, सेम 3 सिम्टम्स है. ठीक है. That is why dysphagia is important. Dysphagia here it is more pronounced to liquid, and second it is progressive in nature. Second, here young males are affected, over there elderly patients are affected. ठीक है. First line investigation would be a on barium swallow with sign is seen. Now here you can see a sharp margin, therefore it is known as a, so in atresia cardia barium swallow shows, in atresia cardia barium swallow shows. Bird beak sign is also known as pencil tip sign. Bird beak sign is also known as pencil tip sign. समझ गए क्यों पेंसिल टिप दिया? क्योंकि शार्प है वो, इसीलिए. ठीक है. So pencil tip और bird beak on barium swallow suggest your pencil tip और bird beak on barium swallow suggest your atresia cardia में barium swallow पे bird beak sign, also known as investigation of choices. Esophageal, you need to check for the esophageal pressure. So the investigation of choice would be manometry. On manometry, the pressure would be more than at the lower esophageal sphincter. ठीक है. And here you can see in atresia, अगर bird beak या pencil tip classical नहीं दिख रहा है, the proximal esophagus would be dilated, whereas the distal esophagus would be collapsed. Treatment of choice, please tell me. Treatment of choice. Now here there can be multiple surgeries which are done. Lifestyle modification is the first one. Drugs can be given. Drugs are which one? Again, to relax the smooth muscles, we can give either calcium channel blockers or nitrates to the patient. If patient does not respond to medical therapy, then we can perform a endoscopic balloon dilatation. Okay, उससे भी नहीं होता है. Then we can do the treatment of choice nowadays it is Heller's myotomy. Cardiomyotomy बोल दो. Heller's cardiomyotomy. What is the treatment of choice? For atresia? Heller's cardiomyotomy. Myotomy means we will give multiple incisions. Okay, therefore the muscles would be relaxed. The pressure would be relieved. Okay, no issues with this. So what is the treatment of choice for atresia? Heller's cardiomyotomy. No issues with this, anybody? Yaad rakhna. Apart from that, we can also have a surgery which is not the treatment of choice, but it is done per orally. So a per oral endoscopic myotomy surgery, that is known as POEMS. Per oral endoscopic myotomy surgery known as POEMS. ठीक है. तो ऐसे अजीब नाम होता है ना, ये क्वेश्चन में आने की ज्यादा प्रोबेबिलिटी रहती है. ठीक है. हाँ, पोएम्स यूजुअली आजकल हो रहा है ज्यादा, क्योंकि यू कैन गो फ्रॉम द नेचुरल ऑरिफाइस. ठीक है. कॉम्प्लिकेशन ऑफ atresia कार्डिया वुड बी पोर्टल वेन की वजह से हो सकता है. वेरी गुड. स्क्वैमस सेल कार्सिनोमा. ओके, इंपॉर्टेंट कॉम्प्लिकेशन ऑफ atresia कार्डिया is squamous cell carcinoma. Important complication is squamous cell carcinoma of the esophagus. हमने देखा था बैरेट की वजह से adenocarcinoma, but atresia की वजह से squamous cell carcinoma of the esophagus. No issues with this, so this is important to be remembered. Then if I talk about this barium swallow, last exam. So this barium swallow is known as what? Which appearance? Corkscrew appearance on barium swallow suggests your corkscrew appearance on barium swallow suggests your diffuse esophageal spasm. Diffuse esophageal spasm. Okay. Corkscrew appearance is also called as appearance. Curling esophagus भी बोल सकते हो. Corkscrew appearance is also called as curling esophagus or the classical rosary bead appearance. It is also called as the rosary bead appearance. ठीक है? तो rosary bead appearance क्योंकि आजकल image देने का इनका फंडा नहीं रहा है. So if they mention rosary bead appearance on barium swallow, one liner without image question आए, then also it is the same. ठीक है? That is why it is important कि तुम appearances के alternative names या appearance होता क्या है वो याद रखो. ठीक है? Battle signs सबने रख के बैठे थे. So that is important. So please remember barium swallow पे corkscrew appearance is seen in diffuse esophageal spasm. Corkscrew appearance is also called as rosary bead appearance. Corkscrew appearance is also called as rosary bead appearance. In atresia cardia, the LES pressure was more than 25 mm of Hg, but in DES the esophageal pressure would be more than 120 mm of Hg. In DES the pressure is more than. In DES the pressure is more than. In DES the pressure is more than, and therefore the investigation of choice here also would be esophageal manometry. Investigation of choice here also it is esophageal, whereas the first line it is barium swallow. No issues with this. If the pressure of the lower esophageal sphincter exceeds 180, then it is called as nutcracker esophagus. If the pressure exceeds 180, it is called as. If the pressure exceeds 180, it is called as. If the pressure exceeds 180, it is called as. ये क्वेश्चन था वन लाइनर था प्रीवियस ईयर क्वेश्चन एफएमजी सॉल्यूशंस में दिख जाएगा तुम्हें. नटक्रैकर esophagus. Okay, more than 180 mm of Hg. No issues with this anybody? हाँ बोलो. वो यूजुअली अभी वो हाइपर तुम्हारा है ना हाइपर पेरिस्टाल्टिक esophageal spasm बोलते हैं उसको. नया एडिशन वो. You don't need to remember it. At least इतना याद रख लो. More than 120. मेडिसिन का क्राइटेरिया is more than 120. In diffuse esophageal spasm, there can be one more variant जिसमें pressure can reach up to 300 to 400 mm of Hg also. ठीक है? No issues with this. Treatment in diffuse esophageal spasm is also myotomy. Treatment here also is myotomy. Next, a 4-week-old male newborn was brought with complaints of projectile non-bilious vomiting. On feeding, peristalsis is visible. Olive-shaped mass is felt in the epigastrium. Mother had taken which drug during pregnancy? Shabash. Mother had taken which drug? Okay, erythromycin. So if a mother takes erythromycin during pregnancy, which fetal anomaly can be seen in the child? Which fetal anomaly is seen in the child? Which fetal anomaly is seen in the child? CHPS is what? Congenital hypertrophic pyloric stenosis. Congenital hypertrophic pyloric stenosis. It is also called as idiopathic hypertrophic pyloric stenosis. No issues with this. याद रखना. It is due to intake of which drug during pregnancy? Erythromycin. Okay, ये important question है आ चुका है. It is due to intake of erythromycin. Important. So now it is usually CHPS presents in which age group? It does not present at birth. It does not present at birth. It usually presents after 2 to 3 weeks. It usually presents after. And classically at 4 weeks. Classically at 4 weeks. Okay. It is usually seen in which child? Male child. It is usually seen in which child? Male child. The first newborn male child in the family. Okay. The first male child in the family. No issues with this. Classically, it is associated with them. Then which type of vomiting is seen? Projectile or non-projectile? So projectile vomiting seen. Which type of vomiting? Which type of vomiting? What do we mean by CHPS? Congenital hypertrophic pyloric stenosis. That means the stomach outlet is formed by the pyloric canal. If the pyloric canal is hypertrophic, the stomach outlet obstruction would occur. And if there is any obstruction, there would be a projectile vomiting in the child. Okay, but the obstruction is before the bile can mix with the food, and therefore it would be which type of vomiting? Non-bilious. Which type of vomiting? Non-bilious. Bilious vomiting is seen in duodenal atresia. Bilious vomiting is seen in. Non-bilious is seen in CHPS. Non-bilious is seen in. Here next is classical. On when the child is feeding, you can examine the child and the peristalsis would be visible. A peristaltic wave would be visible, and a classical olive-shaped lump is felt in the epigastrium. Olive shaped lump in the epigastrium is suggestive of olive shaped lump in the epigastrium is suggestive of sausage shaped lump in the epigastrium is suggestive of intussusception. Very good. Sausage shaped lump is suggestive of intussusception. Yaad rakhna. So here the diagnosis is CHPS, congenital hypertrophic pyloric stenosis. What is the first line investigation? First line investigation is a abdominal X-ray. First line investigation is abdominal X-ray. And which sign is seen? Single bubble sign. Which sign is seen? Which sign is seen? Which sign is seen? Double bubble sign in duodenal atresia. Triple bubble sign in jejunal atresia. Multiple bubble sign in ideal atresia or bowel obstruction. Okay? Then next investigation that I can perform is a barium swallow for esophagus, barium meal for stomach, barium meal follow through for small intestine, barium enema for colon, barium enema for colon. ये important है याद रखना. So here I will perform stomach में problem. So I will perform a barium. Here I will perform a barium on barium meal. Which kind of appearance is seen with sign? So this is with sign mushroom sign. The first is the second. This is known as which sign? String sign. This is known as not string of Cantor. String of Cantor is seen in wrong disease. This is known as which sign? String sign. This is known as which sign? String sign. Also termed as double track sign. Also known as so double track sign is also known as string sign is also known as. And third one over here you can see what is this sign? Looks like a shoulder, na? Therefore it is known as a shoulder sign. ठीक है, so यहाँ पे भी देख सकते हो caterpillar sign would be there, mushroom sign is there. Okay, this one is the shoulder sign and this is the double track sign or the string sign. So जल्दी से barium meal of CHPS. Where barium meal of CHPS shows first, second. String sign is also known as and third. All these signs are seen on which investigation? Barium meal. On X-ray we can see. यहीं पे खेल जाएंगे वो तुम्हारे साथ. ठीक है, इन्वेस्टिगेशन कौन सा है और साइन कौन सी दिख रही है, यहाँ पे कंफ्यूज मत होना प्लीज. Then in this patient usually there is constant vomiting. A chronic vomiting would be there in this patient. August का क्वेश्चन था which type of electrolyte abnormality would be seen? If there is continuous loss of HCl from the body, there would be metabolic alkalosis. ठीक है. Now Cl भी जा रहा है. That means there would be hypochloremia. So it would be hypochloremic. Second hypokalemic. Metabolic along with paradoxical. So जल्दी से बता दो paradoxical aciduria क्यों होता है. So please remember guys, now the body is suffering from metabolic alkalosis due to chronic vomiting in the patient, okay, and therefore the body tries to compensate. So metabolic alkalosis would be compensated by excretion of bicarbonates. But along with bicarbonates, we know by symptoms we also excrete sodium, and therefore the patient will have hyponatremia. As soon as body gets hyponatremia, body cannot afford hyponatremia. Therefore, which system is activated? RAS. And when RAS is activated, aldosterone is secreted. Aldosterone का function क्या होता है? Retention of sodium and water and excretion of potassium and H+ ions. And therefore, if there is excretion of potassium ions, that will cause hypokalemia. Excretion of potassium causes hypokalemia. And excretion of H+ ions in urine is called as acid urea. Excretion of H+ ions in urine is called acid urea. Why paradoxical? Because actually body is deficient in H+ ions, but still we are excreting H+ ions, and therefore it is called as paradoxical aciduria. समझ गए? So which electrolyte abnormality is seen in CHPS? Hypochloremic, hypokalemic, metabolic alkalosis. Proper. Which electrolyte abnormality? Hypochloremic, hypokalemic, metabolic alkalosis, along with paradoxical aciduria. No issues with this, anybody? Proper. Investigation of choice बताओ जल्दी. Investigation of choice is the ultrasound abdomen. Investigation of choice is the ultrasound abdomen. Investigation of choice is the ultrasound abdomen. Treatment of choice would be very good. Treatment of choice is the Ramstead pyloromyotomy. You will give a cut in the pyloric, hypertrophied pyloric musculature. So treatment of choice is CHPS. Treatment of choice for CHPS. Treatment of choice for CHPS. Ramstead pyloromyotomy. Treatment of choice for atresia. Heller's cardiomyotomy. For CHPS, Ramstead pyloromyotomy. Don't get confused. Okay? Now please tell me which is the most common cause of hematemesis. Hematemesis means blood and vomiting. It is usually suggestive of upper GI hemorrhage. Whereas hematochezia means fresh blood and stools. Hematochezia is fresh blood and stools, and it is suggestive of lower GI hemorrhage. So hematemesis की most common cause in adults is or adults and children. Hemorrhoids upper. It is peptic ulcer. Disease. Most common cause of hematemesis is. Most common cause of hematemesis is. Followed by. Most common cause of hematochezia in adults is. बराबर बोला था वो. Most common cause of hematochezia in adults is. Most common cause of hematochezia in adults is. Most common cause of hematochezia in children 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 is. Most common cause of hematochezia in elderly is. Most common cause of hematochezia in elderly is. Most common cause of hematochezia in elderly is. जल्दी से. Most common cause of hematemesis PUD, followed by most common cause of hematochezia in adults. Adult hematochezia. Children hematochezia. Elderly hematochezia. Shabash. Oh, don't make mistakes now. Melena is suggestive of lower GI hemorrhage or upper GI hemorrhage? Melena में क्या होगा? There would be black tarry stools, and black tarry stools would not be due to fresh blood. It is due to occult blood, and it is suggestive of upper GI hemorrhage on which the gastric enzymes act. Until it comes in stools, it turns black in color. ठीक है? Next, if I talk about peptic ulcers now, more common are gastric or duodenal ulcers? More common are most common site for gastric ulcer is. ये तो fingertips पे हो यार. Most common site for gastric ulcer is. Very good. Lesser curvature. Most common site for gastric ulcer is. Most common site for gastric ulcer is. If they ask you specifically at which part of lesser curvature, at the incisura angularis, which is a bend. ठीक है? So most common site for gastric ulcer is. Most common site for gastric ulcer is. Most common site for duodenal ulcer is. First part of duodenal, that is D1. Most common site for duodenal ulcer. Most common site for duodenal ulcer. Most common site of PUD अगर पूछे तो D1 ना. Pain in cases of gastric ulcer, meal pain होगा या hunger pain होगा? So pain is after meals in 30 मिनट बाद. भाई ठीक है, 30 मिनट बाद खाने के immediately pain किसमें होगा? Gastric ulcer. And hunger pain usually after 2 to 3 hours of meal it is seen in hunger pain है. After meal pain would be bleeding is more common in duodenal or gastric ulcer. So most common complication of duodenal ulcer is. Most common complication of duodenal ulcer is. Most common complication of duodenal ulcer is. Most common complication of PUD would be again bleeding. Duodenal common है, so it would be bleeding. Most common complication of gastric ulcer would be. Most common complication of gastric ulcer is perforation. Most common complication of gastric ulcer is perforation. No issues with this. Now the bleeding artery in gastric ulcer is left gastric artery. Bleeding artery in gastric ulcer is. Bleeding artery in gastric ulcer is. Bleeding artery in gastric ulcer is. Most common artery to bleed in duodenal ulcer or the most common artery to bleed in PUD overall. It is Gastroduodenal artery. Most common artery to bleed in duodenal ulcer. Most common artery to bleed in PUD. अरे जो भी more common है उसके more common चीजें होगी ना. So duodenal ulcer, if it is more common, so more common artery to bleed would be in PUD, gastroduodenal artery. Don't get confused. ठीक है? Perforation usually. Please tell me, perforation in gastric ulcers usually occurs in where? Anterior, posterior ने कहा होता है वो. जो तुम बता रहे हो वो duodenal का बता रहे हो. So gastric ulcer perforates in the lesser sac. Gastric ulcer perforates in the lesser omental sac. Gastric ulcer perforates in the lesser omental sac. No issues with this. Duodenal ulcer, it can be either anteriorly or posteriorly. More common perforation in duodenal ulcer is anterior. P does not go for PSA. Perforation is not posterior. Perforation is anterior. So more common perforation in duodenal ulcer is and if there is a perforation in the peptic ulcer disease, there would be release of air from the intestine into the peritoneum. That is what is called as pneumoperitoneum. Question बहुत classic है और बहुत बार आ चुका है. So pneumoperitoneum की first line investigation would be what? The first line investigation for pneumoperitoneum is and on X-ray we can get which sign? So here you can see blackening under diaphragm, that is gas under diaphragm, and gas under diaphragm is known as which sign? Abhi bolo. Cupula sign. This is known as which sign? Cupula sign. Also, it seems like mustache, so it is also known as mustache sign. So mustache sign or cupula sign are a feature of pneumoperitoneum. Mustache sign or cupula sign are a feature of gas under diaphragm is a feature of pneumoperitoneum के X-ray पे कौन से signs दिखते हैं? First is cupula sign. Second is, and why are these signs seen? Because there is gas under diaphragm. No issues with this. If there is perforation, what is the treatment of choice? Jaldi. Treatment of choice for perforation would be definitely laparotomy should be done. Along with that, repair the perforation, and that is what is done by. यार classic names तो याद रख लो. Graham's omental patch repair. So how is perforation repaired? By Graham's omental patch. So omental patch is applied on the perforation. So what is the treatment of choice for pneumoperitoneum? What is the treatment of choice for perforated duodenal ulcer? Laparotomy plus Graham's omental patch repair. Okay, it is a Graham's omental patch repair. Graham का question आ चुका है exam में. ठीक है? Important. Then next, if I talk about gastric ulcer, what is the surgery? Surgery in gastric ulcer, jaldi. पहले gastric ulcer ये बता दो barium meal पे कैसा दिख रहा है यहाँ पे gastric ulcer? You can see what are these? These are nothing but filling defects. What is seen on barium meal? So ऐसा कोई picture आता है. So it is suggestive of gastric ulcer usually. ठीक है? So what is the surgery in gastric ulcer? Gastric highly selective vagotomy is usually done in cases of duodenal ulcer because it is a acid hypersecreting ulcer. So if you say me highly selective vagotomy, it is usually a surgery of choice in highly selective vagotomy is a surgery of choice in highly selective vagotomy is a surgery of choice in highly selective vagotomy is a surgery of choice in. But if there are recurrent duodenal ulcer, then I will perform. Very good. If recurrent duodenal ulcer, then I will perform. If there is recurrent duodenal ulcer, then I will perform along with drainage operation because there can be decreased gastric emptying. For drainage, I will perform. क्या? Antrectomy. Very good. थोड़ा जोर से बोलो. Antrectomy. ठीक है. Pyloromyotomy भी कर सकते हैं, but the better one is antrectomy for drainage. ठीक है? So the treatment of choice for recurrent duodenal ulcer. भाई खा लिया, अब क्या नींद निकाल रहे हो? Treatment of choice for surgery of choice for duodenal ulcer, highly selective vagotomy. Surgery of choice for duodenal ulcer, highly selective vagotomy. Recurrent duodenal ulcers के लिए truncal vagotomy plus Antrectomy. Truncal vagotomy plus antrectomy is the surgery of choice for. It is the treatment of choice for recurrent duodenal ulcer. For normal duodenal ulcer, it is highly selective vagotomy. We only cut the branches of the vagus nerve because otherwise it can decrease the innervation to the gallbladder and therefore it can there would be a higher risk of gallstone formation. Surgery अब तक याद नहीं आई तुम्हें? Cut करते हैं stomach. Resection and anastomosis of stomach, which is Billroth 1 and Billroth 2. Resection and anastomosis of stomach for gastric ulceritis. It is Billroth 1 or Billroth 1 or Billroth. So Billroth 1 mein what is done after resection? In Billroth 1, what is done after resection of the affected ulcer? What is done? Resection plus gastroduodenostomy. For Billroth 2 accidental surgery T. What is done? Here you will do again resection plus gastrojejunostomy. किसको उठाओगे? Gastrojejunostomy. So jaldi say, what is the surgery of choice for gastric ulcer? Billroth 1 or Billroth 2. What is the surgery of choice for gastric ulcer? Billroth 1 or Billroth 2. In both of them you will perform resection, but anastomosis would be different. In Billroth 1 it is gastro. In Billroth 1 it is gastro. Billroth 2 it is gastro. Billroth 2 it is gastro. D पहले आता है, so Billroth 1. J बाद में आता है, so Billroth 2. No issues with this. Easy. Duodenum पहले आता है, jejunum बाद में आता है. Anyways, ठीक है. Then if I talk about these surgeries, what are these surgeries called as? Anybody? These are called as bariatric surgeries. These are called as bariatric surgeries. Also called as metabolic surgeries. They are done in cases of morbid obesity. ऐसे images दे चुके हैं वो, ठीक है, और image दे के बस इतना ही पूछा है which is this surgery, ठीक है. Whipples का भी दे चुके हैं, Roex and Y gastrojejunostomy का भी दे चुके हैं, ठीक है. So important है, याद रख लो. So if the first one, here you need to decrease the size of the stomach ना, कि ज़्यादा ना खाए वो मोटा, ठीक है. So the first one is gastric banding. क्या हुआ? First one is gastric banding. It is done by laparoscopy. No issues with this. Laparoscopic gastric banding can be done. Okay? It is the safest surgery. Next, we can perform a sleeve gastrectomy. That means half of the portion of the stomach is resected and only a sleeve-like stomach is left behind. No issues with this. So that is known as sleeve gastrectomy. And this one, ये image देख लो यार अच्छे से, important है बहुत ज़्यादा. Then it is known as the best surgery for bariatric surgery is Roex and Y gastric bypass surgery. The best one is Roex and Y gastric bypass surgery. So here directly we do a gastrojejunostomy. No issues with this, anybody? कोई दिक्कत नहीं है. Then now please tell me this important है guys. A patient underwent gastric surgery, that is Billroth surgery, he underwent. Now a patient post gastric reconstruction surgery presents with epigastric pain, bloating, fullness in the epigastrium. क्या होगा complication? Which dumping? Bloating. Very good. It is the early dumping syndrome. This is the early dumping syndrome. So please remember, if the patient presents to you after gastric reconstruction surgery with epigastric pain, fullness and bloating, it is which dumping syndrome? Early dumping syndrome. And if a patient presents to you post gastric surgery with episodes of sweating, tachycardia, dizziness, then it is more likely a late dumping. Then it is a late dumping syndrome. Please tell me, early dumping syndrome is due to? Late dumping syndrome is due to osmotic overload. Okay, it is due to hypovolemia. समझना है, short में समझ लो. Now what happens directly? See, yeah, stomach is not left behind. Now from esophagus, the food will directly drop into the intestine. The body is not acquainted to this. Okay, so if you eat high sugar food, that is highly carbohydrate rich food अगर खाते हो, that would be hyperosmolar in nature. So this hyperosmolar food, if it goes directly from the esophagus to the intestine, what will happen? All the blood flow would be directed towards the intestine, and that will cause hypovolemia in the patient. All blood flow is directed towards the intestine. Therefore, the patient will feel heaviness or fullness in the epigastrium, pain, bloating, and there can be symptoms of. Usually, the patient can be like features of shock. Shock में नहीं जाएगा, but there can be features of hypotension usually. ठीक है, hypovolemia would be there because all the blood flow is directed towards the intestine due to the hyperosmolar food. Second is late dumping. Here the cause is what? Here the cause is hypoglycemia. Here the cause is hypoglycemia. So here the patient will have increased insulin secretion, and due to the increased insulin secretion, what will happen? There would be features of hypoglycemia like sweating, tachycardia, dizziness, all of them, palpitation. No issues with this. Hypovolemia is hypoglycemia is early dumping में hypovolemia, late dumping में hypoglycemia. Treatment would be giving small frequent meals to the patient. Okay, avoiding large heavy meals, avoiding sugar rich or fatty, sugar rich or carbohydrate rich food. ठीक है, that will help. And अगर नहीं improve होता, then you can do a surgery again. Treatment investigation of choice would definitely be upper GI endoscopy. Investigation of choice is what? Upper GI endoscopy. And for suspicion, you can also take a biopsy. Why is biopsy taken? Just to rule out any malignant changes. Just to rule out any malignant changes. Barrett's में भी इसीलिए लेते हैं हम. ठीक है? Gastric cancer. Classification for gastric cancer is known as, नाम बताओ. Classification of gastric cancer is known as Borman's classification. Classification for gastric cancer is known as classification for gastric cancer is known as. Okay, there are total 5 types. The most common type is the type 1. Most common is the type. Okay, most common is type 1. It is polypoidal. Type 1 is, and type 4 is the most malignant. Type 4 is most malignant. So here there would be infiltration in diffuse. There would be a diffuse infiltration of the stomach wall, and therefore the stomach wall will become thick like a leather bottle, and that is what is called as rhinitis plastica. That is what is called as rhinitis plastica, also known as leather bottle stomach. Also known as. So leather bottle stomach is which classification of Borman's? Type 4. It is type 4. Polypoidal is type. Most common is type. Most malignant is type 4. No issues with this. Rhinitis plastica is also called as leather bottle stomach. Diffuse infiltration of the stomach wall. ठीक है? Important ये leather bottle stomach का question आ चुका है, rhinitis plastica वाला. Now if I talk about gastric cancer, most common type of gastric cancer, anybody? Whether it is squamous or adeno? Definitely the most common type of gastric cancer is because the lining is columnar in nature, right? Investigation of choices. Symptoms would be same. There would be vomiting, chronic weight loss. Dysphagia would not be there, but vomiting would be there. Failure to grow. All of these features would be there. Usually it is seen in 5th to 6th decade of life in females. Right. Treatment of choices: upper GI endoscopy plus cancer है ना. Upper GI endoscopy plus. Most common site of metastasis is liver. Most common site in Western countries is usually which part of stomach? In Western countries, which part of stomach is commonly involved with gastric cancer? Proximal stomach in Western countries. Proximal stomach in worldwide or in India it is. अरे stomach के part पूछ रहा हूँ मेरे बाप. So most common site of gastric cancer worldwide is antrum. Most common site of gastric cancer worldwide is Western countries. No issues with this. जैसे esophagus में था, worldwide it was mid 1/3. In Western countries it was lower 1/3. Likewise in gastric cancer in Western countries it is proximal stomach. Worldwide it is antrum. कोई दिक्कत नहीं है, याद रखो. Gastric cancer, if I talk about metastasis, most common site is definitely liver. It occurs by hematogenous spread. But there can also be some lymphatic metastasis also. And this lymphatic metastasis occurs to usually which lymph node? Left supraclavicular lymph node. Which lymph node? Left supraclavicular lymph node. Metastasis to left supraclavicular lymph node from gastric cancer is known as which sign? It is known as which sign? It is known as which sign? Troisier sign. Also known as which node? Also known as which node? Virchow node. Also known as which node? So metastasis to left supraclavicular lymph node is Troisier sign or Virchow node or which lymph node metastasis? Left supraclavicular. Which lymph node? Left supraclavicular. कोई दिक्कत नहीं है. If the metastasis occurs usually to periumbilical region, if it occurs to the periumbilical region, it is known as which metastasis? It is known as Sister Mary Joseph nodule. This is known as Sister Mary in periumbilical metastasis. Periumbilical metastasis, Sister Mary Joseph nodule. And left supraclavicular lymph node metastasis, Troisier sign or Virchow's node. Left axillary lymph node metastasis, Irish node. Irish node. ठीक है, Irish. Left axillary lymph node metastasis, Irish node. And bilateral, ये तो आना ही चाहिए. Bilateral ovarian. Bilateral ovarian metastasis is. Bilateral ovarian metastasis is. Bilateral ovarian metastasis is. And which cells are seen on biopsy in gastric cancer or Crookenberg tumor? Which cells are seen? Which cells are seen? Which cells are seen? Signet ring cells are seen. ठीक है, no issues with this. ठीक है, important. If I talk about the treatment of gastric cancer, early gastric cancer, if it is only limited to the mucosa or the submucosa, then it can be treated by. Then it can be treated by endoscopic resection. It can be treated by endoscopic. If it is early stage of gastric cancer, it can be treated by. Early stages of gastric cancer is treated by endoscopic resection. Endoscopic resection. But if it is an advanced gastric cancer, if it is in the proximal stomach, then treatment of choice would be proximal stomach. Treatment of choice would be proximal stomach में है, इधर है almost. क्या करोगे? पूरा ही स्टमक निकालना पड़ेगा ना. So total gastrectomy. Proximal stomach is. Proximal stomach is. Proximal stomach is. Distal stomach is. Subtotal या partial gastrectomy. Distal stomach is. Distal stomach is. इतना कोई hard फंडा है नहीं, ठीक है? If the cancer is in the proximal stomach, treatment of choices. If the cancer is in the proximal stomach, treatment of choices. If the cancer is in the distal stomach, treatment of choices. If the treatment is in the distal stomach, treatment of choices. Partial gastrectomy. After partial gastrectomy, you will pull up whom? You will pull up either duodenum or jejunum. So gastroduodenostomy or gastrojejunectomy. More likely a gastrojejunectomy is done. No issues with this, anybody? कोई दिक्कत नहीं है अभी, याद रखना. Early gastric cancer is treated by endoscopic resection. Advanced gastric cancer in proximal stomach is treated by. Advanced gastric cancer in distal stomach is treated by subtotal or partial gastrectomy. No issues with this, anybody? Shabash. Total gastrectomy, when you do, you pull up the jejunum and construct the stomach. ठीक है? Then GIST is what? Gastrointestinal stromal tumor. What is GIST? Gastrointestinal stromal tumor. It is which kind of a tumor? Epithelial or a mesenchymal? So please remember, it is the most common mesenchymal tumor of GIT. It is the most common mesenchymal or connective tissue tumor of GIT. No issues with this. It originates from which cells? It originates from the interstitial cells of. It originates from the interstitial cells of. So GIST originates from the interstitial cells of, and these are known as pacemaker cells of stomach. These are known as pacemaker cells of stomach. So the most common site for GIST is. 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 Investigation of choice for GIST is. Investigation of choice for GIST. So it does not require a biopsy. ठीक है? So investigation of choice for GIST is CECT abdomen. Investigation of choice for GIST is. Investigation of choice for GIST is CECT abdomen. बाकी cancers में तुम करते हो, but in GIST you do not need a biopsy. Therefore, the investigation of choice is CECT abdomen. What is the best tumor marker for GIST? So the most specific or the best tumor marker is. Most specific or the best tumor marker is. Whereas the most commonly used is. Most commonly used is also known as also known as C. So the gene mutation is also C. Gene mutation is also C. Best tumor marker is dog. Most specific is dog. Most commonly used is CD1. कोई दिक्कत नहीं है इसमें. Treatment would be done by if it is advanced cancer, then we do chemotherapy. Okay, but in early cancers, resection is a better choice because recurrence rate would be higher. ठीक है, recurrence में क्यों छोड़ना है तुम्हें patient में वापस तुम operate करो. But definitely surgery is the treatment of choice usually. And what centimeter margin is taken? 2 centimeters of margin is taken. And if we need to do chemotherapy in advanced stages, it is done with tyrosine kinase inhibitors like imatinib. It is done with tyrosine kinase inhibitors like imatinib is the drug of choice for which leukemia? Anybody? A patient presents to emergency room with upper abdominal pain, retching episode. ठीक है, again retching episode आया है. You were not able to insert the rise tube. So now any patient who comes to you with upper abdominal pain, retching episode, you can also suspect intestinal obstruction. Therefore, you are trying to insert a rise tube or a nasogastric tube in the patient, but you are not able to insert the nasogastric tube. So what is the diagnosis over here? Very good. It is the stomach volvulus or gastric volvulus. So the diagnosis over here is stomach volvulus or gastric volvulus. What is the triad? Upper abdominal pain, retching, and inability to insert RG tube. Sorry, RT tube. कौन सा triad? This is known as which triad? This is known as which triad? So Bochart triad is seen in gastric volvulus. Bochart triad is seen in Meckel triad was seen in Boras syndrome. Meckel triad was seen in. What are the three features of Bochart triad? First is upper abdominal pain. First is. Second is retching. Second is, and third is inability of inserting RT tube. Third is inability of inserting RT tube. Investigation of choice would be contrast study. Investigation of choice would be a contrast study. A CCT abdomen can be done. What would be the treatment? Treatment would be decompression and reduction. So volvulus means malrotation of the stomach. Okay, the stomach rotates around its axis. Okay, so इसमें there is a higher risk that the stomach will undergo necrosis because the blood vessels will be compressed. Okay, so if the the stomach is normal, okay, it has not undergone necrosis, the treatment of choice would be decompression, air nikal lo, and then derotate it. Okay, so decompression and reduction, or rotation, whatever you can say. Okay, but if the stomach is necrosed, then you need to do resection and anastomosis. If the stomach is necrosed, then you need to do resection and anastomosis. No issues with this, anybody? Which triad is seen? Bochart triad. In which condition? Gastric volvulus. A neonate presented with bilious vomiting at birth. X-ray is given. Investigation of choice. So this was the X-ray. Okay? Yeah, X-ray. So neonate presented with bilious vomiting. X-ray shows which sign? Duodenum ka ek and usually stomach ka ek. This is known as the which sign? And double bubble sign on X-ray is seen in. Duodenal atresia. That means the duodenum is not formed in this child. Okay? So here the child would present to you at birth or after few weeks. So the child will present to you at birth. But in CHPS, the child presents after 2 to 3 weeks. The child presents to you after 2 to 3 weeks. In CHPS, there were which kind of vomiting? Non-bilious. But in duodenal atresia, there is a bilious vomiting. No issues with this, anybody? Yaad rakh lo. X-ray shows over there which side? Single bubble sign. Here in duodenal atresia, double bubble sign. Investigation of choice, anybody? Investigation of choice would be CCT abdomen. Investigation of choices. CCT, abdomen. First line would be X-ray. ठीक है? Treatment of choice, anybody? So you will attach the both ends. Okay, that is what is called as duodenal anastomosis or या फिर duodenostomy. Duodenostomy. But if duodenostomy is not possible, then duodenojejunectomy. Then duodenojejunectomy. No issues with this. What? Okay. Duodenostomy or duodenojejunectomy. That is what is anastomosis. No issues with this. ठीक है? तो digestomy भी कर सकते हो. ठीक है? तो digestomy भी कर सकते हो. ठीक है? No issues with this. If there is a triple bubble sign on X-ray, so triple bubble sign on X-ray suggests your jejunal atresia. It is suggestive of jejunal atresia. Jejunal atresia shows which sign on X-ray? Triple bubble sign. And here you can see which sign. Here it is called as a multiple bubble sign. एक तो multiple bubble sign बोल सकते हो इसको, or you can call it multiple air fluid levels. You can call it multiple. Classically, they describe it as multiple air fluid levels. They describe it as multiple, and this multiple air fluid levels on an X-ray abdomen or multiple bubble sign is suggestive of ileal atresia, or multiple air fluid levels are suggestive of intestinal obstruction. It is suggestive of intestinal obstruction. ठीक है? So it can be ileum or it can be in the colon as well. ठीक है? So it is suggestive of intestinal. No issues with this. So what is the X-ray feature of intestinal obstruction? What is the X-ray feature of intestinal obstruction? Multiple bubble sign or multiple air fluid levels. Intestinal obstruction can be of two types. Either it is dynamic. Dynamic means there is a physical obstruction. Means maybe a stone or a fecalith, anything is obstructing. Okay? That means that there is a dynamic obstruction. Dynamic too, because the peristalsis would be normal. So dynamic obstruction would be there, and aerodynamic is usually when the peristalsis is not there. Okay, peristalsis is seen in, but peristalsis would be absent in. Aerodynamic का example is paralytic ileus. Aerodynamic का example is paralytic. So when after a surgery the patient does not regain his bladder motility, that is what is called as paralytic ileus. That can also occur. ये question था, which electrolyte abnormality can cause paralytic ileus? Hypokalemia. It can be caused by hypokalemia. याद रखना. Whereas dynamic obstruction, the most common cause for dynamic obstruction is no issues with this, anybody? First investigation to be done in intestinal obstruction is abdominal X-ray. First investigation is no issues with this, anybody? Investigation of choice would be what would be done for treatment? Keep the patient nil per oral. Give IV fluids. Insert nasogastric tube to the patient. Okay? So all of this would be done. And if the obstruction does not relieve, then you need to perform a laparotomy. And repair whatever it is. Okay, whatever is the obstruction, you need to remove it. If it is paralytic ileus, usually the intestine will gain its motility, or if it is hypokalemia, you need to treat the hypokalemia. Okay, yaad rakho. Then what is this sign on a plain abdominal X-ray? If I can get this sign, so on a plain abdominal X-ray, if I can get this sign, it is known as a appearance. Batao. This is known as which sign? Coffee bean sign. This is known as the coffee bean, and coffee bean sign on plain abdominal X-ray suggests your and this is barium enema. Barium enema पे which sign? Barium enema पे. So barium enema पे which sign? Plain abdominal X-ray पे which side? Plain abdominal X-ray पे, and both of these are suggestive of. Both of these are suggestive of. Both of these are suggestive of sigmoid volvulus. When there is malrotation of the sigmoid colon along its axis, most common site, अगर वो पूछे, the most common site to undergo volvulus, answer is sigmoid colon. Most common site to undergo volvulus, answer is. Most common site to undergo volvulus, answer is. Management would be done by. वही gastric volvulus के लिए क्या किया था? Decompression and derotation. Decompression and decompression and decompression and. No issues with this. So you will decompress the sigmoid colon, remove the air, and de-rotate it in its abnormal position. Okay. Emergency में treatment is decompression and de-rotation. Gastronomy, ये कौन सी surgery है? So decompression and de-rotation. But followed by that, if there is recurrence in this patient, then you can perform a sigmoidectomy. Then you can perform a. So definitive management is sigmoidectomy. Definitive management is. Definitive management is. Definitive management is. Emergency management is. Emergency management is. तो अगर इमरजेंसी में पेशेंट आता है वो ट्रीटमेंट ऑफ चॉइस पूछते हैं, आंसर इज डिकम्प्रेशन एंड डी-रोटेशन. आफ्टर फ्यू डेज इफ देयर इज रिकरेंस देन यू कैन परफॉर्म sigmoidectomy. No issues with this. Plain abdominal X-ray with sign. Barium enema with sign. Barium enema. Plain abdominal X-ray. No issues with this anybody. A child was brought with abdominal pain and hematochezia, that is fresh blood in stools. Doctor says it to be remnant of the vitellointestinal duct. Investigation of choice and treatment. पहले तो diagnosis बताओ. So here what you can see, it is this one is a Meckel. So diverticulum, as I told you, diverticulum is nothing but outpouching from a organ. It is outpouching from a organ. Meckel's diverticulum, it is present from birth. Therefore, it is called as congenital diverticulum. That is not the reason it is called as true. Okay, so Meckel's diverticulum, it is present from birth. Therefore, it is called as congenital diverticulum. All layers of the bowel are present. Therefore, it is called as all layers are present. Therefore, it is called as all layers are present. Therefore, it was called as. Okay, and it is due to pressure or traction. So it is a pulsion or traction diverticula. So it is a traction diverticula. बाहर से pressure है ना, तो बाहर से खींच रहा है कोई. ठीक है? Next, it is due to a remnant of vitreointestinal duct. A question which came recently, important है. Sorry. A question which came recently. A child was brought to you with feces coming out from the umbilicus. Diagnosis is, ये मैंने embryology की वीडियो में कवर किया. A child was brought. Gastroschisis is intestine coming out from the paraumbilical region, and intestine with a peritoneal covering is omphalocele. I am saying feces. ये recent question था. Feces coming out from the umbilicus. See, I hope all of you are quite aware. During intrauterine life or fetal life, there is a connection between the gut or between your intestine and your umbilicus. That there is a connection between your gut and your umbilicus. That is what is called as your vitellointestinal duct. That is called as your vitellointestinal duct. If this vitellointestinal duct does not obliterate after birth, then there would be a vitellointestinal fistula. And then therefore there would be feces which will travel from the gut to the umbilicus. And therefore feces coming out from the umbilicus, it is usually suggestive of vitelline fistula or vitellointestinal fistula. Important question है ये, recently आया था, urine वाला भी आया था. So please remember, feces are coming out from umbilicus. It is due to vitellointestinal. If feces are coming out from umbilicus, it is बोलो मेरे बाप, vitellointestinal fistula. If feces are coming out from umbilicus, it is vitellointestinal fistula, also known as the vitelline fistula. If urine is coming out from the umbilicus before birth, definitely there was an abnormal connection between the urinary bladder and umbilicus also. If it does not obliterate after birth, अगर ये birth के बाद खत्म नहीं होता, then there can be urine coming out from the umbilicus. And if urine is coming out from the umbilicus, it is due to patent urachus. So that is what is called as the urachus fistula. That is what is called as the urachus fistula. No issues with this. Anybody? समझ गए? Feces coming out from umbilicus. Feces coming out from umbilicus. Urine coming out from umbilicus. Urachus fistula. याद रखो ये सर्जरी से क्वेश्चन है. Fistula is a one-way connection or two-way connection? So fistula is a two-way connection. Fistula is a two-way connection between organ or skin. Between organs. Between sinus is one-way or two-way connection. Sinus is a one-way connection. Sinus is a one-way connection with skin. One-way connection with skin. Therefore, the pus discharging sinuses क्या होती है? Skin से pus बाहर आ रहा होता है. Okay. Diverticulum is one-way or two-way connection. क्या दिख रहा है? It is a one-way connection with the organ. One-way connection with the organ. तो जल्दी से one-way connection with organ is called as. One-way connection with organ is called as. One-way connection with skin is called as. One-way connection with skin is called as. And two-way connection with organ is called as. No issues with this. अभी समझ गए? याद रखो. So here the child had abdominal pain and hematochezia, that means bleeding per rectum, and the doctor says it is a remnant of vitreointestinal duct. So as I told you, remnant of the vitreointestinal duct or patent vitreointestinal duct would be vitreointestinal fistula. But if there is partial remnant will form Meckel's diverticulum. Complete remnant fistula, partial remnant Meckel's diverticulum. कोई दिक्कत नहीं है अभी, ठीक है? So partial remnant of vitreointestinal duct is called as Meckel's diverticulum. कभी कभी ऑप्शन में एक बार vitreointestinal duct के बजाय उन्होंने दिया था omphallomesenteric duct. The answer is same, omphallomesenteric duct. Okay, याद रखो. What is the investigation of choice for Meckel's diverticulum? Technetium 99M per technete scan. What is the investigation of choice? Technetium 99M per technete scan. Investigation of choice is Technetium 99M per technete scan. ये अलग है, इसीलिए याद रखो. Investigation of choice for Meckel से Technetium 99M per technete scan. ठीक है? As we know, Meckel follow rule of two. Rule of two क्या होता है? 2% of the population is affected. 2 inch long होता है वो. 2 feet proximal to the iliocecal junction होता है. And there are 2 ectopic, 20% cases will present with heterotrophic or ectopic mucosa. If they ask you which is the most common ectopic mucosa, most common ectopic mucosa in Meckel cells, most common ectopic mucosa in Meckel cells, gastric mucosa. Most common ectopic mucosa in Meckel cells, most common ectopic mucosa in Meckel cells. What is the treatment? If it is narrow, if it is a narrow mouth, then treatment would be diverticulectomy. If it has a narrow mouth, the treatment would be, if it has a narrow mouth, treatment would be diverticulectomy. If it has a wide mouth, then usually पहले तो हम observation करेंगे, wide mouth होगा तो कुछ नहीं होगा उसको. But if they ask you about treatment or surgery, then the treatment would be resection and anastomosis. Resection and narrow mouth तो narrow mouth है तो wide mouth है तो resection anastomosis. Wide mouth है तो resection anastomosis. No issues with this, anybody? Meckel's is important. This image came earlier. A child was wedge resection audits नहीं करते. Usually wedge resection nothing but wedge resection plus anastomosis वही होता है. Wedge in the sense triangular form में करते हैं, इसलिए उसको wedge बोला जाता है. A child was brought with abdominal distension, vomiting and pain. What is your diagnosis? Abdominal pain, distension, vomiting, along with these kind of stools. What are these stools? These stools are known as red currant jelly stools. These stools are known as red currant. These stools are known as red currant, and red currant jelly stools are seen in. Red currant jelly stools are seen in. So here the diagnosis would be intussusception. The diagnosis is intussusception. Intussusception is what? Invagination of intestinal loop into the adjacent intestinal loop. That is what is called as a intussusception. As you can see over here. Okay? So here you can see one loop of the intestine has invaginated into the adjacent loop. That is what is called as intussusception. It is more common in children around like 3 years of age. Till 3 years of age, intussusception is more common in children. Okay? The patient will present to you with abdominal pain, abdominal distension, and vomiting. Okay. The first line investigation would be anybody. So first of all, I will perform a palpation. I will do a palpation. On palpation, which kind of lump is seen? Which olive-shaped lump in CHPS. Olive-shaped lump in, olive-shaped lump in, sausage-shaped lump in, sausage-shaped lump in, sausage-shaped lump in, intussusception. Okay, which shape of lump is felt? Sausage-shaped lump. And the right iliac fossa would be empty. And this empty right iliac fossa is called as which sign? Anybody? Empty right iliac fossa is called as Dan sign. Empty right iliac fossa is called as, empty right iliac fossa is called as, because the iliocecal junction would be pulled upwards, and therefore there would be an empty right iliac fossa, which is called as, so which shape of lump? Which shaped lump? Empty right iliac fossa known as which sign? Most commonly which age group is affected? Most commonly which age group? Children. So most common site of intussusception, anybody? Most common site of intussusception or most common site of intussusception in children? Ileocolic. Ileocolic. The ileum invaginates into the cecum. Ileum invaginates into the cecum. Most common site for adults, agar wo puche, then the answer would be, most common site for adults is, most common site for adults is, most common cause for children, most common cause for intussusception in children, idiopathic, followed by hypertrophy of Peyer's patches. Idiopathic followed by hypertrophy of Peyer's patches. Peyer's patches are nothing but lymphoid tissue in the ileum. Lymphoid tissue in the ileum. Ye question tha. What are Peyer's patches? Those are nothing but lymphoid aggregates in the ileum. And hypertrophy of them can cause ileocolic intussusception in children. Adults mein colocolic is due to polyps in the intestine. Okay? The cause is polyps. Investigation of choice, anybody? Children it is. Investigation of choice for children it is. Investigation of choice for children it is. But for adults it is. For adults it is. For adults it is. No issues with this. On ultrasound, intussusception will show with sign. On ultrasound, intussusception shows with sign. On ultrasound, intussusception shows with sign. Or this one known as the pseudo kidney sign. Target sign or pseudo kidney sign or on which investigation? On which investigation? Jo tum bol rahe ho, that is this one. On barium enema it will show with sign. On barium enema it shows. On barium enema it shows. On barium enema it shows. Or this one which is known as the coiled spring sign. It is known as the coiled spring sign. Which sign? Coiled spring sign. So claw sign or coiled spring sign in intussusception on which investigation? Whereas target or pseudo kidney sign on intussusception in which sign? USG. No issues with this. Jaldi se treatment batao. Kya ho gaya hai? Treatment would be hydrostatic reduction. Treatment would be hydrostatic, and this hydrostatic reduction would be done with the help of enema. ठीक है? So enema के through तुम कोई fluid दोगे. That is what is hydrostatic reduction. So treatment of choice of intussusception is. Treatment of choice of intussusception is. कोई दिक्कत नहीं है इसमें. I hope so. Moving further, what is this? This is a colonoscopy. On colonoscopy, what is seen? Outpouching from the colon. What it is called as? Diverticulosis. So this here the diagnosis is outpouching from the intestinal wall. Most common site of diverticulitis, anybody? Diverticulosis. Most common site of diverticulosis is. Most common site of diverticulosis is. Most common site of diverticulosis is. Diverticulosis mein the first line investigation would be barium. The first line investigation would be barium. Colon mein hai na, so barium enema. Which appearance is seen in barium enema? Which appearance is seen on barium enema? Which appearance is seen on barium enema? Sawtooth appearance. No issues with this, anybody? Shabash. So, investigation of choice would be. Investigation of choice is CE-CT. Investigation of choice is CE-CT. Investigation of choice is CE-CT abdomen. No issues with this. What is treatment? वो तो रखेंगे, वो तो सर्जरी के लिए, ट्रीटमेंट आई एम आस्किंग. Resection and anastomosis. Resection and so that means either we'll perform a sigmoidectomy. Okay, so we will remove the sigmoid colon or we will remove the affected part. Okay, so if it is the cecum, we will perform a right hemicolectomy. If it is the sigmoid, we will do a sigmoidectomy. That means a resection and anastomosis is done. Resection and anastomosis. Resection and anastomosis. No issues with this, anybody? I hope so. ठीक है, कोई दिक्कत नहीं है. So diverticulosis, the most common complication can be inflammation, that is diverticulitis. Most common complication is so usually diverticulosis, the patient would be asymptomatic, it would be an incidental finding, but diverticulitis, the patient will come to an emergency with abdominal pain. कोई दिक्कत नहीं है, याद रखना. More common in elderly patients. Then jaldi se ye fill up karo. Inflammatory bowel disease, if I talk about, it is either Crohn's disease or ulcerative colitis. Most common part affected in Crohn's is, Crohn's can affect any part from the mouth till anus. Okay, only which part is spared? Rectum is spared. Which part is not involved in Crohn's? Which part is not involved in Crohn's? But the most commonly affected part is ulcerative colitis. Most commonly affected part in ulcerative colitis is rectosigmoid. Most commonly affected part in ulcerative is one answer should be rectum followed by sigmoid. Features की अगर मैं बात करूं, Crohn's disease will start with ulcerative colitis will start with no issues with this. Then involvement, Crohn's disease would be superficial or transmural. Crohn's disease will involve all the layers of GIT. That means it would be, so Crohn's disease is ulcerative is superficial, only mucosa or submucosa. Skip lesions are a feature of continuous lesions are a feature of association. jaldi batao. Crohn's disease is associated with the most common extraintestinal manifestation of inflammatory bowel disease. Arthritis. Okay, Crohn's disease is associated with whereas ulcerative colitis is associated with primary sclerosing cholangitis. Inflammation of your biliary tract. Investigation jaldi batao. Antibody चाहिए मुझे. Crohn's disease में the antibody seen are ASCA, anti-Saccharomyces cerevisiae antibody. Antibodies in Crohn's are anti-Saccharomyces cerevisiae antibody. क्या बोलोगे short form? ASCA. Antibodies in Crohn's are antibodies in ulcerative are investigation of choice for Crohn's is, so for Crohn's or ulcerative colitis, investigation of choice is same. It would be colonoscopy or upper GI endoscopy plus biopsy. It would be an upper GI endoscopy plus or colonoscopy plus. So usually it is a colonoscopy plus biopsy because the lower part is affected more commonly. In ulcerative colitis, in Crohn's disease, biopsy will show us क्या दिखेगा biopsy में Crohn's के? Cobblestone appearance is seen in colonoscopy. Non-caseating granuloma. Biopsy feature of Crohn's is whereas in ulcerative colitis we will get crypt abscess. In ulcerative colitis we will get surgery for Crohn's disease or ulcerative colitis would be resection and anastomosis. anastomosis. That is what is called as, here it would be proctocolectomy. Here it would be proctocolectomy. ठीक है, proctocolectomy with ideal pouch anastomosis. ठीक है, here it would be, in Crohn's it would be colectomy. Okay, whichever area is involved, depending on that you will perform a colectomy, either a hemicolectomy, transverse colectomy, anything. ठीक है, drug of choice for Crohn's, jaldi. Drug of choice for Crohn's are, drug of choice for ulcerative is sulfasalazine. 5 ASA derivatives like sulfasalazine. No issues with this. पहले तो drug ही दोगे. If the patient is not responding, then you will move on to surgery. If I talk about colonoscopic finding of both these conditions, what is this? Cobblestoning is a feature of, cobblestoning is a feature of, pseudopolyps are a feature of, pseudopolyps are a feature of. Then if I talk about radiological investigation, if I perform a barium enema in Crohn's disease, what is seen? String sign of Cantor. In sorry, in Crohn's disease, what is seen? String of Cantor. In Crohn's disease, what is seen? String of Cantor. In Crohn's disease, what is seen? String of Cantor. ठीक है? Whereas in ulcerative colitis, what is seen? In ulcerative colitis, we will find a lead pipe colon. In ulcerative colitis, Crohn's disease, string of Cantor, string of Cantor. No issues with this, anybody? Jaldi se aage. A neonate was brought to pedia emergency with complaints of no passage of meconium. On DRE, meconium floods out. What is the diagnosis and management? So the diagnosis is Hirschsprung's disease. The diagnosis is Hirschsprung's disease. ठीक है? The diagnosis is Hirschsprung's. Classical case ये meconium ileus का भी हो सकता है, but here if there is extensive involvement, it is usually Hirschsprung's disease. ठीक है? So neonate if brought to emergency with no passage of meconium and on DRE meconium floods out, then it is a classical case of Hirschsprung's disease. Hirschsprung's disease in neonate will present with no passage of meconium, but in child it would present with, if small segment is involved, then the child will present to in childhood, like around 3 to 5 years of age. The child will present with chronic constipation. The child will present with chronic. So neonate presents with no passage of meconium. Neonate presents with no passage of meconium. Child presents with Hirschsprung's disease is due to absence of, ganglion cells. In which plexus? Both plexus, Orbach as well as Meissner's. There is absence of ganglion cells in both plexus, Orbach as well as Meissner's, as well as there is loss of which cells? Ganglion cells. And therefore the motility or the peristalsis of the intestine is lost. If I perform a barium enema, which is the first line investigation, what is seen? A proximally dilated colon is seen and distally collapsed colon is seen. Proximally कैसी होगी? Proximally there would be dilated and distally there would be, distally it would be collapsed colon, right? So this is what is seen in cases of Hirschsprung's disease. Management is done by treatment. Surgery क्या होती है? सबने surgery बोल दिया. Surgery कौन सी? Very good. It is the Duhamel's operation. Which operation? Or we can perform the Swenson's operation. Which operation? Swenson's operation. And third is Sove and Parkes coloanal anastomosis. Sove and Parkes coloanal. ये नाम याद रखना बस. वो नहीं पूछेंगे सर्जरी कैसी की जाती है, but at least they will ask you the names of surgeries, और वो important भी है यार. अगर तुम्हें Hirschsprung's पूरा diagnose करना आ गया, you don't even know the surgery name, क्या आंसर करोगे? वन लाइनर सीधा सर्जरी के नाम रट लो. सर्जरी में मैंने तुम्हें बोला है टेबल बनाओ, इन्वेस्टिगेशन, साइन जो दिखती है और सर्जरी, तीनों टेबल में होना चाहिए, सब डिसीजेस के, जीआईटी का और यूरो का. तो ऐसे ही याद होगा सर्जरी. ओके, तो जल्दी से व्हाट इज द सर्जरी इज डन इन Hirschsprung? फर्स्ट is second is Swenson, second is, third is Sove and Parkes coloanal anastomosis. Then if I talk about this barium enema, here you can see some sign. What is this sign called as? This sign is called as thumbprint sign. This sign is called as Thumbprint sign on barium enema is suggestive of. Very good. It is suggestive of ischemic. Thumbprint sign on barium enema is suggestive of. Thumbprint sign on barium enema is suggestive of. Most common site for ischemic colitis. Anybody? Most common site for ischemic colitis, जहां blood supply नहीं होता है. So the watershed area of colon, splenic flexure. It is the splenic flexure. ये watershed area के बारे में question आया था. 2 watershed area होता है, एक rectum में होता है, एक splenic flexure पे होता है. ठीक है? Most common site. Now talking about colon cancer. Colon cancer में barium enema shows which appearance? Apple core appearance. Colon cancer barium enema shows which appearance? Barium enema in colon cancer shows which appearance? Apple core appearance. Most common site of colon cancer is? Most common site for colon cancer is? Most common site for colon cancer is rectum followed by? Most common site for colon cancer is? Followed by? Most common site for colon cancer is? Followed by? No issues with this. Investigation of choice. Cancer है जल्दी. बायोप्सी करोगे क्या डाल के? कैमरा कहाँ से? एनस से कैसे? That is called as colonoscopy and so investigation of choice is colonoscopy and investigation of choice is colonoscopy and investigation of choice for TNM staging. Again TNM मतलब depth of invasion देखना है तुम्हें. So it would be investigation of choice for नीचे तुम endoscopy मतलब endoscopic ultrasound नहीं कर सकते. So investigation of choice for TNM staging is MRI. Investigation of choice for TNM staging is investigation of choice for TNM staging is investigation of choice for staging is investigation of choice for staging is PET CT. Investigation of choice for staging is investigation of choice for staging is most common site of metastasis is most common site of metastasis is most common site of metastasis is and the investigation of choice for distant metastasis is PET. Agent used is 18 FDG. Treatment of choice in colorectal cancer is so colorectal cancer can be associated with either FAP syndrome or it can be associated with Lynch syndrome, that is HNPCC, hereditary non-polyposis colon cancer. क्या करते हो treatment? So either depending on the lesion usually, okay. So either you will do a total or a hemicolectomy. You will do a total or hemi. So better to answer it as just a minute. ढंग से ही देखता हूँ. So either you will do a total proctocolectomy. क्या करोगे total? Why did I write procto? Anybody? Procto means removal of rectum. और rectum is the most common site. इसीलिए procto लिखना मेरा जरूरी हो गया. ठीक है? So treatment of choice is total proctocolectomy. Or if the lesion is at the cecum or in the transverse colon, then hemicolectomy. Then hemicolectomy. No issues with this anybody? Easy है. कोई दिक्कत नहीं है इसमें. Total proctocolectomy or hemicolectomy is done. What is this sign on barium enema? If I can see this sign, what is this sign called as? Here I can see a pulled up cecum. Very good. Here I can see a pulled up cecum. Along with pulled up cecum, which is this sign called as? This is called as the gooseneck deformity. So pulled up cecum and gooseneck deformity on barium enema are suggestive of, they are suggestive of ileocecal TB. They are suggestive of ileocecal. So ileocecal TB on barium enema gives which two signs? First is, second is most common site of TB in abdomen is ileocecal junction. Most common site of ileocecal TB is most common site of abdominal TB is most common site of ileocecal TB. Most common site of abdominal TB is ileocecal junction and the terminal ileum. No issues with this anybody? Those signs, pulled up cecum and gooseneck deformity. If I talk about anal cancer is which type of cancer? Squamous or adeno? So it is a squamous cell carcinoma. It is a squamous cell carcinoma. Important. Okay, there can be multiple risk factors for anal cancer, but an important virus which is responsible for anogenital cancer, that is HPV, human papilloma virus. So which virus is responsible for anogenital cancer? Human papilloma virus. Which strain? 16 and 18. 16 and 18. What is the treatment of choice for anal cancer? Anybody? Investigation of choice is definitely a biopsy. You can easily perform a biopsy in anal cancer. Is it a surgery? Is it chemotherapy or is it a radiotherapy? Treatment of choice is chemo, radiation. मान गया तुम्हारे ये पावर को, इमेजिनिंग पावर को, पता नहीं क्या क्या सर्जरी के नाम निकाल रहे हैं. Treatment of choice is chemo, radiation. Treatment of choice is chemo, radiation. And this chemo radiation is given by which regime? Important था. Chemo radiation in anal cancer is given by. Chemo radiation in anal cancer is given by. Chemo radiation in anal cancer is given by Negro's regime. Important है. Then if I talk about this rectal prolapse, rectal prolapse means the perineum was weak and therefore the rectal mucosa, submucosa, all layers of the rectum are protruding out. So protrusion out of the anal verge is what is called as the prolapse. Okay? So that is the rectal prolapse. Rectal prolapse can be either partial or full thickness rectal prolapse. In partial rectal prolapse, the layers which are involved are only mucosa, and in partial rectal prolapse it is only mucosa, and but in full thickness they would be all layers. In full thickness there would be all layers. Most common age group for partial thickness would be, partial thickness is more common in, partial thickness rectal prolapse is more common in, partial thickness rectal prolapse is more common in, full thickness rectal prolapse is more common in, full thickness rectal prolapse is more common in. Treatment for partial thickness, if it is the first episode of the child, then you can do digital. First episode में digital, or if it is recurrent, then we can do Thiers. Recurrent में Thiers. Whereas in full thickness, we can do a which repair? Delorme's and Altemier's repair. Delorme's and which repair is done in adult? Delorme's and which repair is done in full thickness? Delorme's and Altemier's repair. ठीक है, इसकी भी गंदी है क्या? ठीक है, Delorme's and Altemier's repair. No issues with this. Next, if I talk about this, what is this? Multiple pus discharging sinus in the natal cleft. So multiple pus discharging sinus in the natal cleft. What is the diagnosis? Image IT. Very good. This is known as pylonidal. मैंने question डाला था इसमें Telegram में. It is pylonidal sinus. It is pylonidal sinus. Operated in which position? Question में डाला था. Prone position. So it is operated in prone position. ठीक है? So most common site is usually the anal natal cleft. Okay, it occurs usually in hairy gluteal skin. Agar there is poor hygiene and there is a hairy gluteal skin and the patient sits for a longer duration of time, then there can be formation of these multiple pits and sinuses in the natal cleft. That is what is called as the pylonidal sinus. And pylonidal sinus is also called as which disease? It is also known as Jib driver's disease. It is also known as Jib driver's disease or Bottom's disease. Jib driver's disease or Bottom's disease. No issues with this, anybody? Resection of sinuses would be done in this condition. Next, if I talk about this, what are these? What are these? Hemorrhoids. Hemorrhoids are also called as abnormal anal cushions are hemorrhoids. Hemorrhoids are also called as piles. ठीक है? Bawasir. Then hemorrhoids can be classified in 4 degrees. Hemorrhoids can be classified in 4 degrees. If they are only internal, okay, if they are only internal, they are called as first degree. Internal hemorrhoids are if they prolapse on straining, and spontaneously reduce, they are, if they prolapse on straining and spontaneously reduce back, they are second degree. If they prolapse on straining, okay, if they prolapse on straining but cannot be reduced, but are not reduced, then these are prolapse on straining but cannot be reduced are. And if they are completely outside, then they are, if they are always outside, then those are, so jaldi se, internal hemorrhoid, prolapse on straining, spontaneously reduced. Prolapse on straining does not go back, completely prolapse out. No issues with this. Jaldi se, investigation of choice for hemorrhoid. Pehle to, hemorrhoids would present with painful bleeding or painless bleeding. Hemorrhoids will present mainly with painless bleeding. Only painful hemorrhoids are external hemorrhoids. Only painful hemorrhoids are primary hemorrhoids occur at which position? This has been asked. Primary hemorrhoids occur at which position? 3, 7 and 11 o'clock position. Primary hemorrhoids occur at which position? 3, 7, 11 o'clock position. Primary hemorrhoids occur at which position? 3, 7, 11 o'clock position. No issues with this, anybody? Yaad rakh lo. Investigation of choice would be proctoscopic examination should be done. Anal fissure mein mat karna. First degree hemorrhoids mein the treatment would be lifestyle modification. Give usually ask the patient to have a high fiber diet. Okay, ask the patient to reduce fatty or fried food intake. Okay, laxatives can be given. Garam pani peene ke liye bol do. All of this lifestyle modifications in first degree. Second degree it would be the better would be banding. Second degree it is followed by the best treatment for second degree is followed by third and fourth degree it is. Previously we used to perform a hemorrhoidectomy surgery. Open या laparoscopic hemorrhoidectomy surgery. Laparoscopic to nahi, open hemorrhoidectomy surgery. Nowadays we have a better option, that is fixation of the hemorrhoid. That is what is called as hemorrhoidopexy, and that is done with stapler. So the third or fourth degree ke liye the treatment of choice is stapler hemorrhoidopexy. We can also perform a hemorrhoidectomy. Either by the Milligan-Morgan's approach or the Ferguson's approach. Next, if you examine a patient comes to you with painful bleeding per rectum. If the patient presents to you with painful bleeding per rectum, you will just examine. Inspection pe you will find this sentinel skin tag and a ulcer or a fissure, that means a breach in the epithelium, okay, along with hypertrophied anal papilla. All of these are suggestive of anal fissure. Why do anal fissures occur in the patient? Chronic constipation. It is due to chronic constipation. Yaad rakhna. Therefore the first line management would be lifestyle modification. Increase the high fiber diet in the patient. Give laxatives to the patient. Okay, laxatives can be given, or we can also give a sitz bath. What is given? Sitz bath. Investigation of choice would be inspection. Investigation of choice would be only inspection, not even digital rectal examination, not even proctoscopy. ठीक है, मार खानी हो तो कर लेना. Then next, what is this? This is a fistula. Okay, so perianal fistula are common with Crohn's or ulcerative? Perianal fistula are common with Crohn's disease. Perianal fistula and strictures are common with Crohn's disease. So here there is a perianal fistula. It can be either a superficial fistula, okay, only connecting with the skin. It can be an intersphincteric fistula, which passes from between the internal sphincter and the external sphincter. A transsphincteric fistula, which crosses both the sphincters. A suprasphincteric fistula, which opens above both the sphincters. An extrasphincteric fistula, which is outside the sphincters. So jaldi se, most common out of all of these is which fistula? Most common is the intersphincteric fistula. Most common is the. So fistula is what? Abnormal connection, na? So there it is usually formed. A fistulous tract, most common cause is due to infection of anal glands. Yaad rakhna, theek hai? So most common type is intersphincteric fistula. What is the treatment of choice? Jaldi se. So if it is a low fistula, then you can just use a seton. Okay, if it is a low fistula, you can just use a seton. Okay, to fibrose the fistulous tract. If it is a high fistula, then you need to perform a fistulo. That means open the fistulous tract only. Open up the fistulous tract, or you can even perform fistulectomy. You can also perform a fistulectomy. No issues with this. याद रख लो जल्दी से. Low fistula के लिए seton should be inserted. Seton is a thread which is inserted which causes fibrosis of the tract. And high fistula के लिए fistulotomy or fistulectomy. Then what is this? ये investigation आ चुका है. Investigation का नाम एक बार पूछा था और दूसरी बार diagnosis पूछा था. So a child presents to you with non-passage of meconium. क्या है? Neonate है. What is this? This is the metallic body which is placed at the anus, and then you invert the child and then take an X-ray. This is what is called as the invertogram. This is what is called as the उल्टा है ना बच्चा? So this is what is the invertogram. याद रखना. An invertogram is the first line investigation for. It is the first line investigation for anorectal. It is the first line investigation for anorectal. First line investigation for anorectal malformation is. First line investigation for anorectal malformation is invertogram. You actually measure the distance between this gas and the metallic body, and depending on that you diagnose it whether it is a low anorectal malformation or a high anorectal malformation. Accordingly you treat the patient. दो चीजें important है. First, which investigation is this? Invertogram. It is the first line investigation for anorectal malformation. दो चीजें याद रखनी है बस. We'll do appendix, pancreas, gallbladder. नेक्स्ट क्लास में कर लेंगे, ठीक है. If you want it in short, I can just end it in short as well. The only reason why I'm taking this in deep, last time बहुत सारे बच्चों ने chanting के नोट्स उठा के लास्ट में पढ़ा था.